this meeting to order, the El Paso County Board of Health meeting on December 15th, 2021. And we have a large number of important action items today, which we must address. We also have a large number of citizens here today, both in person and online, who wish to make a comment today. We want to get through these agenda items and be respectful of the public commenters' time as well. So let's plan on doing both. I just want to remind everyone of our rules as it relates to civil and orderly behavior. And our conduct of the meeting today is guided by Robert's Rules of Order. And the two words that I'd like us to remember are respect and listen. And we will respect you and listen to you, and we would ask the same. Because during the meeting, we all learned some things. We do not interrupt each other or speak over each other. We do not use derogatory language or personal insults. We are respectful of each other as we conduct the work of the Board of Health. Likewise, with a large number of persons here in attendance, we will remind everyone there are no interruptions of our proceedings allowed, no clapping, shouting, booing, or cheering. So, with that behind us, let's proceed to the roll call. And Commissioner Gonzalez. Here. Commissioner Bremer.
Here.
Councilmember Donaldson.
Here.
Fire Chief Colas.
Here.
Ms. Kari Kilroy.
Here.
Dr. Richard Vu. Here. Ms. Doris Ralston.
Here.
And I'm here. So we have a quorum of Board of Health members. Thank you. Now, let us proceed to the approval of the agenda. And you have the printed agenda in the packets in front of you. It's been published.
I move for the approval of our agenda today for December 15th.
Okay, I'd entertain a second.
Second.
Okay, let's take a vote. All in favor of approving the agenda as written?
Aye.
Aye. Any nays? No? Okay. So, Robert's Rules of Order allows us to limit discussion on any items to no more than 3 minutes of comments or questions by any individual board member on any particular topic, and no more than 30 minutes total for any action items. So this is a request from the chair. Board member comments about that proposed motion. Any comments?
No.
No?
This is Councilman Donaldson, Mr. President. Is your motion or your suggestion to limit to 3 minutes?
Per individual, on any individual subject.
Very good.
Okay. Any more comments or questions? Okay, I'd entertain a motion.
So moved.
And a second? Okay, just to be clear, it's to limit each member's comments and questioning to no more than 3 minutes on any particular subject and no more than 30 minutes total on any particular action item.
Then,
Okay.
Mr. President, this is Councilman Donaldson again.
Yeah.
I thought you were referring to speakers today, the folks that were going to come and talk to us. If you are referring to the board members, then I will not. I don't agree with that. I think if board members want to speak longer than 3 minutes, they should be allowed to.
Okay. All right. So we've had a motion and a second, and let's take a vote. So, Commissioner Gonzalez.
I have a clarifying question. So 3 minutes, so I can do 3 minutes on
Any topic.
an initial one, and then I can do another 3 minutes during the
Right.
the vote.
Any topic that comes up.
Aye.
Okay. Commissioner Bremer.
I, with the clarification that I believe that if questions are raised that require some good dialogue among the board, and we can stay with the civility and the proper things, but really work through any questions that might come up. I think stated comments of 3-minute limit is absolutely okay. But I think if there are questions that this board needs to discuss, I wouldn't really want to limit the dialogue too much on that.
Fair enough. The motion was intended for initial comment. Okay. Ms. Kari Kilroy.
I agree with Commissioner Bremer, and aye.
Okay. Fire Chief Golis.
Aye.
Dr. Richard Vu.
Aye. Dr. Turbush, I want to
Yes.
say, is your suggestion based on Robert's Rules of Order?
Correct.
So I think our bylaws
Okay.
spells that out.
And Doris, we got you? Your vote?
Aye.
Okay, and I vote aye. So 7-1. So it's passed.
I don't think I was, am I first to vote?
Pardon?
Was I the first to vote?
Yes.
Has this ever been done before, Dr. Turbush, on the Board of Health?
No, not that I remember. And the purpose is to go ahead and facilitate the progress of the meeting and to keep things moving.
Is there something special about this meeting where it's never been done before, but today you think it needs to be done?
I do, because of the large number of public commenters, we need to be respectful of their time and get to their comments.
This doesn't pertain to the public commenters, though. This pertains to board members, correct?
Right.
But Dave,
Well,
if we
I
talk,
appreciate your concern for the public commenters.
May I say something?
Who's next?
May I say something, Dr. Turbush?
Yes, oh, please.
What I am understanding that you're asking for is that to limit board comments during item number 3 only to 3 minutes. It's not the entire meeting?
It would be, my intent was for the entire meeting for introductory comments.
I just wanted to clarify.
Yeah.
Okay, thank you.
All right, any further discussion? Not hearing any, let's, okay, we voted? All right, 7-1. So that's what we'll do with the rest of the meeting. And now we're going to move into Board of Health member comments, and I'll save mine for last.
Dr. Turbush, I'd like to acknowledge and thank Dr. Robin Johnson for her many years of service as medical director of our public health department. And she's built many bridges and relationships and has worked tirelessly on our county's health's behalf. And she was a key member and leader of our public health team. She'll be missed, and I wish her well. In addition, I'd like to recognize our public health director, Susan Whelan, for her unwavering leadership during this pandemic. I personally appreciate Susan and her entire team for all of their accomplishments this year, not only their achievements concerning the pandemic, but with all of the other public health responsibilities that they've had to achieve. She and her team and many, many community partners are credited with the fact that our county has attained 416,000 fully vaccinated people out of an eligible population of 679,000. Furthermore, I'd like to thank Commissioners Bremer and Gonzalez for supporting the Board of Health's budget appropriations at the County Commissioners meeting December 7th, particularly the additional $150,000 that was part of Public Health's 5-year budget plan and approved by the Board of County Commissioners several years ago. Thank you.
Thank you. Other Board of Health member comments? No? Okay. My comment is much the same. I would really like to thank Dr. Robin Johnson for her service and dedication to helping to promote and protect the health of the citizens of El Paso County during the most severe public health crisis in a century. We plan to get her back to our meeting in January for a more formal presentation and award, but just wanted to state my personal regard and admiration for the selfless service which Dr. Johnson has displayed during her entire tenure at the health department, and I would say that she is a friend. Thanks are not enough, Robin, and we will introduce Dr. Urbino a little bit later, who will be filling in, at least temporarily, for Dr. Johnson during the director's report. So thank you, Dr. Urbino. Okay, the next action item. Any other board member comments? Nope. Next action item is approval of the minutes. So these are in your packet. We actually have 2 meetings to approve the minutes of. So let's take these one at a time, and I would entertain a motion to approve the minutes of our meeting of October 27th.
So moved.
Second?
Second.
All in favor?
Aye.
Aye.
Any opposed? Okay, so moving on, I'd entertain a motion to approve the minutes of our meeting of November 10th.
So moved.
We need a motion
So moved.
and a second.
Second.
All in favor?
Aye.
Aye.
Okay, our next action item is finance and budget, and this is a required piece of business where we approve our public health budget for the next year. And here with us to present finance and budget are Lori Clayton and Samantha Montmany. Did I get that right?
You did. Thank
Oh,
you.
I got lucky. Okay, from the El Paso County Finance Department. Okay, it's over to you.
Good morning. Samantha Montmany, I'm Budget Supervisor for Health and Human Services. The first item I have for you guys is the November report. At this point in time, this is very similar to what you guys saw last month, and we have no concerns at this time. Do you guys have any questions?
Board members, you have these slides in front of you as well. So any questions?
Mr. President, this is Councilman Donaldson. I do have a question. Monitors in front of me aren't working, so let me just write slide on paper.
Which slide number? 5, okay.
It's actually going to be on a different slide, so thank you.
Pardon? It's not working. That's why you can share it with Jen. So we're there. Okay. Let me just ask, are there any questions from or comments from members of the public about these financial sheets that we're about to approve? Any public comment? No? Okay. Samantha, continue, please.
So the next item is a contract for you guys. It is the El Paso County Subrecipient Agreement. Oh, sorry about that. So the next item is a contract, which is a subrecipient agreement with El Paso County for the American Rescue Plan Act funding that the public health is receiving. This contract is for funding received in 2021 and 2022. It goes over the reporting and compliance requirements for the administration of these ARPA funding.
Comments or questions from board members? Okay, please proceed.
You guys need to vote to sign on that one, to sign the contract. I believe you need to vote to approve the contract.
Okay.
I move to approve signing this contract.
Second.
All in favor?
Aye.
Okay.
So the next item is the 2002 original adopted budget for Paso County Public Health. Next slide, please. So overall changes from the preliminary balanced budget is an overall increase of about $585,000 in revenue. This is partially the increase for the critical needs that El Paso County approved, and also additional support for personnel.
Okay.
The revenue also change was also an increase on a radon grant. Increases in expenditures are from our personnel costs of increasing for a 3.5% COLA. And then overall, we are still anticipating using some fund balance. However, this is a slight decrease from the preliminary balance budget. Our strategy still remains that we needed to utilize some fund balance to offset the critical needs positions that were put in place. However, using this fund balance will still keep the fund balance within the fund balance policy of 18 to 21%. Next slide, please. So these are the overall numbers. The total revenue that we are anticipating for 2022 for public health is $29,560,943, with the total expenditures of $29,824,157. Next slide, please. So this slide just shows a breakout of the revenue that we're anticipating. Next slide. And this one is a breakout of the expenditures. A majority of the expenditures are sitting in personnel, with some other additional operating expenditures. Next slide. Do you guys have any questions on the original adopted budget?
Any questions from board members at this point? No? How about any comments or questions from members of the public who are here?
Dr. Turbush, I have a comment.
Okay.
I want to recognize that El Paso County Public Health is doing such a wonderful job under a very tight budget. So thank you.
Thank you, board member. Dr. Vu. Okay, that one doesn't need a vote, but item D does. So Samantha, if you could continue.
Slide. The next one is to a resolution to adopt and appropriate.
Move to approve.
Second.
Okay, all in favor?
Aye.
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 Any opposed? Okay,
All right. Thank you.
thank you very much. Okay. Item number 6 is Director's Report, and this will be our Public Health Director, Susan Whelan. Please.
Good morning, Board of Health. My name is Susan Whelan. I serve as your Public Health Director for El Paso County. I wanted to provide a few updates before we get into COVID. As you are all aware, that Dr. Johnson has been a wonderful medical director, and we have served with Dr. Johnson well before COVID. And these past 22, 23 months have been really remarkable in the sense of launching an emergency response that has lasted this long. And as former Fire Chief Colas can attest to, when you have a fire or a flood, it certainly doesn't last this long, and how taxing it is on the emergency response staff. And so not only for public health, but for our numerous partners that have been in the COVID response. And just wanted to thank Dr. Johnson for her service. She's on a much needed vacation the next couple of weeks, but we will be working with Dr. Urbina, and I'd like Dr. Urbina to come up here and introduce him. We are very fortunate that Dr. Urbina has served as our medical director for many years when Dr. Johnson has not been available. When she's on vacation or she's not available for a phone call. And he has lots of experience in public health. He also serves as a contract medical director for numerous different parts of the state, and I have high confidence in his expertise, and I keep in touch with him throughout the pandemic, also even with Dr. Johnson's service. So a little bit about Dr. Urbina. Is that he is a 20-year veteran of public health systems in Colorado and New Mexico. He is certified in family medicine and preventative medicine. He earned his master's of public health from Johns Hopkins in 1989, and his MD from the University of Colorado in 1980, and his bachelor's of science in biology from Stanford in 1976. He currently serves as a medical officer for the Pueblo Department of Public Health since 2016, and he has served, as I had mentioned, for other county health departments throughout the state of Colorado. He has also served as the executive director for the Colorado Department of Public Health and Environment from 2011 to 2013, and he was also the director, full-time job, for the Denver Public Health Organization from 2004 to 2011, and we are very fortunate that he will be on contract for our agency until I'm able to post, hire, and recruit a medical director for El Paso County. And Dr. Urbina, did you want to introduce yourself?
Oh, good point.
I introduced myself to all the board members earlier, and I'm very glad to be here. Thank you, Director Whelan, for the nice introduction. As you know, I'm not a CV or a resume. I'm a real person, and I'm here to serve in any capacity you'd like me to do. I've worked all over the state, and I think you should be very proud of your director and your leadership, as well as your team. This is an excellent team, and I'm very fortunate to be able to come and work with you. I'm looking forward to it. Thank you very much.
Great. Well, I speak for all the board. Welcome, Dr. Urbino. Look forward to getting to know you better. Thank you, sir.
And one more update before we get into agenda item regarding Board of Health emails. I wanted to make mention that we completed our 2019 and 2020 annual report, and you all received it, and we shared it pretty far and wide with Colorado Springs City Council and others. But there's a tremendous amount of accomplishments in there. And 2020 was the year where we had our first case of the novel coronavirus, and much action and accomplishments have been observed in that annual report. And I wanted to emphasize throughout, whenever we have board meetings or whenever I'm on some type of public platform, I want to give thanks, a heartfelt thanks, always to my staff and my team, because they are steady, hardworking to serve the community. And I know that the work is unrelenting. Many of them are here today, many of them are not. And I wanted to make sure that they're always recognized and they know that how much that they are appreciated by the public and numerous different partners in the organization. But that 2019 and 2020 annual report, if you haven't had a chance to look through it, it's just a fabulous report, and we will be working on a 2021 report. But since we're close to the end of the year, I thought it was appropriate that we look back and reflect on all of the accomplishments. I know that we have difficulties to work through. I know we have challenges, but as I've said throughout this pandemic and COVID response, we don't accomplish much unless we're together. We're not always going to agree on everything, but we can accomplish so much together to serve the public and do the best that we can do. So with that, I will get into the item of emails. I know that Board of Health emails, we typically used to receive comments about, where's the agenda, the logistics of the meeting, where is the meeting going to be held. And recently we've received an uptick in emails to the Board of Health. So currently what we are doing is sending all of the Board of Health emails to all of you And then I will be looking, and we're also setting up an archive that you can go into previous years and access all of the numerous emails as you deem appropriate. And then I'll be looking for direction from you as to how you would like me to provide you your emails. I will say that I am doing some research on best practice in the state of Colorado, and what I'm finding out with other public health organizations, they don't have a policy, and so I think that they will be looking to El Paso County for a best practice. And so when that comes out, I will share it with them. And much like some of the best practices that involve public health work, I think that that will be appreciated by them as well. What they are currently doing is, in other health departments for the Board of Health, is one of them is working through the Joint Information Center still, so it's coming through the PIOs, and depending on the content of the email, then they will forward it to board members, or they will just take care of the questions. If it's regarding data or hospital data, then they have a system of where they are forwarding those emails. And then some of the county health departments have individual emails for each board member. So if this board would like a Dave Donaldson at elpasoco.com, and you all would like that, then that's something that we can set up as well. So there's a number of different options that I have provided in email. And again, I'm just doing some research on best practice and want to take your direction on what that would look like. And I did ask for feedback so I can compile, and I did receive one board member had been able to take the time to tell me what her thoughts were, and essentially that was, and correct me if I'm wrong, but essentially keeping with the same process of screening and then flagging also any high priority emails and manage these appropriately. But again, I want to do what the board, what you would like to. We are a quality improvement agency, and we're always looking to improve any kind of process. And after what we've been through for the past 2 years, I think managing emails and taking care of that, I'm happy to accommodate a process change.
Well, Director Whelan, thank you. I know you and your staff have done some real quick turns on this, and you'll be able to get back together with us in January for further information and further discussion. But I'd like to linger a little longer on this subject. And are there any board member questions or comments on how we handle the email policy? Yes, go ahead.
Thank you, Mr. Chair. So I kind of like the idea that Susan brought up in terms of, for transparency, for somebody who wants to opt in, if they can code it properly so that individuals, if it's all of us or 3 or 4 of us, want to get every report, that it can be coded so that it automatically goes into you, so that you're receiving them. So that way somebody will always receive every email. I think that's a good initial idea. It sounds like you have multiples, but I'd kind of like to, over the next month, kind of go through that a little bit more. But I think that's an excellent idea, because that means if the board member wants to see every email, they're going to get every email.
Thank you, and I'm going to hit the easy button, so that's being done. So we have worked with county IT, and that every email you all should be receiving. And I'm seeing you shake your head, but that's what I believe is happening.
No, right.
And we worked with IT, so any email that comes to the Board of Health email, it automatically goes to myself and also board members. But there's multiple layers, and again, I'm willing to, however you guys want me to change the process or keep the process to keep you informed.
Other board member input, please. Yes.
Thank you, Mr. President. So I think I'm the one that brought this up, that I wasn't happy with the way emails, and this is the way it's been for years now here with emails that citizens send to you hit the link that says communicate with the Board of Health. But actually those emails first were screened by a public health executive assistant, I think is who's doing it now. If they felt like it was worth sending on to the president of the board, they sent it on to the president. If he felt like it was worth sending on to the rest of the board, it went on to the rest of the board. When I brought up that I thought that was absolutely wrong, and everybody I've spoken to about this agrees that it's wrong, that if a citizen sends an email to the Board of Health, it should go to the Board of Health, all the members of the Board of Health, not be screened initially by someone at Public Health, then by the president of the Board of Health. And then if those two see fit, then it makes it to Councilman Donaldson or Mr. Ted Collis. So an example of why that isn't good is when we voted on this resolution last time, Commissioner Vanderwerf told me he got 200 emails. Mr. Collis, how many emails did you get last time? So Mr. Collis received none. So this isn't something we should be taking our time on. In fact, I'm disappointed it wasn't corrected earlier before this vote we're going to have today. What's happening now is it's still screened by, or a person at Public Health sees it first, and then they forward it to me, right? So I can't click reply and reply to that citizen. I have to then go to a different, type their email address in and start a new email and reply to them. Because if I hit reply, I'm replying to the person at Public Health, or now I'm replying to the entire Board of Health, which I can't do because that violates public meeting law. So again, I'll say I want it fixed today, where whenever a citizen sends an email to the Board of Health, it comes directly to Councilman Donaldson and everyone else. If some if some board members think that's too much and they really wouldn't like to see all those emails, maybe you should consider if you want to serve on the Board of Health. Because part of what we should do is part of what we should be doing is listening to the citizens. And if it's inconvenient or too much work, think twice about that. And honestly, I think it's a mistake. I don't think you understand that citizens have good input. And I hope I haven't violated my 3 minutes yet. Citizens have good input. And some of what they send to me is very meaningful, either personal stories, individual stories, or data that they've seen, or something they've seen in the news, and they communicate that to us. So I'm absolutely disappointed it hasn't been fixed yet. I brought it up to the president of the board, and I said I'd like it corrected today, and it wasn't. I think a couple of weeks later, the policy that we have now, where it's forwarded to me by someone else, was put into place. Let me just look down at my notes for a moment, see if there's anything else. You talk about Susan, you're talking about creating a database or a place we can go and see the emails if we want to. Have any emails been deleted from citizens?
No, and so what we're offering is a database that you can go into manually, see all of the emails, and then moving forward, as the board decides, then I will change the process. If it's okay, could I provide some context around what you're saying?
I think, the context was provided to me in an email that in the past, not too many people have been interested in the Board of Health. Maybe part of the reason they're not interested is because when they send an email, they don't get anything back from Board of Health members.
Okay.
Right? Because those emails haven't actually made it to Board of Health members. And and here's another point I want to make. I saw an email, and what is happening now, citizens, is that the executive assistant, I'm sure she's a good person doing what she's told to do, is now communicating with citizens on behalf of the Board of Health. And in one of those emails, it said, well, hey, the Board of Health already believes this. The resolution today will just simply put that into writing. Well, maybe I don't totally agree with the resolution. So that person shouldn't be speaking for the Board of Health. And I think that's wrong. And I would hope that others sitting up here with me also believe we don't need another person speaking for the Board of Health. We should each speak. Okay? And then if a member here wants someone else to speak for them, they should send a little email, say, hey, I'm going to have this person speak for me, or just have that out there. And it doesn't say that right now on the website when citizens go to it and they click the link to communicate with the Board of Health. It doesn't say the Board of Health won't really see your email, but someone else will communicate for them, or someone will communicate for them, and maybe they'll read it. So I don't mean to seem angry about it, but it's frustrating to me. It's not the way it's done, certainly on city council, county commissioners. If you send something to city council, all the council members get it. There's no one in between you. We can choose for someone to reply for us if we want to, but that will be clear to the citizens.
Can I say something?
Okay.
Dave, I appreciate what you're saying, but I would say in matters when we vote on something as a Board of Health, even if it's not unanimous, when we leave, we should be supporting that resolution. It's not an individual that you're going to go off and say, gee, you know, I didn't agree with that. You need to, we as a board need to be united and to walk out, even if it doesn't pass unanimously, and support that. It's not like being on city council or being a county commissioner. We represent the whole county. And whereas I agree, I would like to get all the emails too, but I don't want to be mired in minutia. I want to know what's going on out there, but definitely don't want to do their work for them, and I think that we need to be united.
Okay.
Well, I would, since that was directed towards me, what we're being told is there are very few emails in the past, so you won't be mired in minutia when citizens send you an email. And in general, I agree with what you say. We should speak as one voice. However, if I'm forced to vote on something which I've asked not to be forced to vote on, and I disagree with the resolution, and a citizen asks me my opinion on it, my personal opinion, I'm going to give it to them. And so I won't accept that if citizens email me, I have to let someone else answer for me, or my answer better be the same as theirs. Don't accept that at all.
Yes. Go ahead. Yes, please, Karen.
Thank you, Dr. Turbush. I would like to set the record a little bit straight. I did serve as chair of this board for 5 years, and I think Mr. Donaldson is mischaracterizing what has actually happened. We did receive, like you said, very few emails. A lot were how to find the agenda, et cetera. And whenever any emails were sent to me, I sent them to the whole board to be aware. I don't disagree with all the board members receiving it. I think when I sent you my comments, my biggest concern was that someone be in charge of the emails so that they got a response. Because if all of us are receiving it, all of us might assume someone else is responding, and then the person would not get any response at all. So that was my biggest concern with all board members receiving it. And I would also say that it is not unusual in organizations, public, nonprofit, private, for there to be a person or persons in charge of receiving communication and triaging it. That is not an unusual situation. Thank you.
Yes.
Thank you. I'll respond to that. That may be the norm in business, but not in government entity.
Okay. Other board member comments? All right. Yes.
Mr. President.
Go ahead. Yummy.
Thank you. Just a quick follow-on. I think when Councilman Donaldson brought this up originally, he was spot on, and my understanding is that the staff was very responsive, and as you said, it pivoted very quickly, and all of a sudden, inboxes were very, very full from us, or from the Board of Health particularly. And I think it's been a great thing. I have spent a tremendous amount of time reading every single one, and some of them I get duplicates of because they'll send it to the county commissioner email, and then I'm getting it from the Board of Health as well. And I am sorting through those. But one of to get back to the policy that Susan is going to put forth and present in January, one of the suggestions that I had as this conversation first began was also that, you know, the written director's report, she'll give us an oral oral report at each Board of Health meeting, but perhaps in the written report that we all receive in our board packets and that is published online as well, that's fairly formulaic with the different departments that she kind of reports out, what's going on with WIC, what's going on in environmental, that we just add a chart where those emails, in addition to the board having access to them, ability to respond to them with a full-on policy, that in addition, there's also a chart that kind of says, we received 2,000 emails this month, pro-con masks, pro-con mandates, sewer requests, and all these other, pool inspection, restaurant inspection, categorize them in a chart for us as well, so that is also very transparent to the public. What the Board of Health is seeing, receiving, digesting, in addition to actually being CC'd on the emails. And she has agreed that the process will be in place to do that, and almost already is. So I just appreciate the receptiveness. I realize that it has meant an increased workload on hardworking county employees who are doing their best to pivot and respond on a constant basis. And I appreciate the diligence with which that's being done and the ability, the willingness to add another tabulation task to that in the interest of both Board of Health members being very informed enough to make decisions that affect the public, and the public also being able to see what that looks like on a larger scale.
Yes.
And Susan, I remember this as others were speaking, that you've mentioned it. Well, in the past, we would just get questions about where's the meeting being held. When I brought this up and it was decided, okay, we'll change it in the future, we'll figure something out, some examples were sent. Well, these are some examples of how emails have been answered by the person in public health. And those emails were about mask mandates. They were about vaccine resolutions. They weren't about the meetings going to be at this building. So I know emails like that were coming in since I've been on the board, and I never saw them. They never made it to my email box. That's wrong. It shouldn't be we have to go to some repository to look for emails. These emails should come to every single board member. If that board member doesn't want to read what the citizens have to say, then they can figure out how to deal with that. If you're worried that, well, maybe somebody won't answer, I'll answer them. I serve on the Board of Health. I'll be happy to do that. I'm sure there are others up here that will also. So to me, this isn't kind of like, well, I guess there's different ways to answer this. These emails should go to every board member with no one in between. They should go directly to us. If Public Health also wants to send a reply back to that person, I don't even know if I think that's right, because it's going to the Board of Health, not to Public Health. But if they want to, it should be stated on that where citizens click and they're going to send an email to the Board of Health. It should say there, this email will also be addressed by a executive assistant from Public Health. I haven't talked to anyone, and I've talked to, for one, the city auditor, other councilmen, other prominent people out there, and none of them think that if you click on Communicate with Board of Health, it shouldn't go to the Board of Health under any circumstances, or that really anyone else should be in the middle. If it says it on there that you may receive a reply from name the person and why, okay, but it doesn't say that now. I think I made my point.
Okay. Any other? Yes.
I just wanted to provide a little bit of context as well, and I just wanted to say that the way that my organization is ran and under my leadership is that we always try to enhance transparency, and I'm happy to do a process change. I think it's an easy fix. I don't really think it's that complicated. We launched a data dashboard to be more transparent with COVID, so we're always working, and as a quality improvement type of organization, we're open to those process changes. So I hear you, and I hear everyone on the board, and I just wanted to say that I believe that my agency has been very responsive, not only to general emails, but to the public and through the Joint Information Center and in this emergency response. So I do think that we have done a good job, and I think that we certainly can do a process change to enhance transparency and however the board directs me, and I think that we've got some good input, and I will do some more research in how organizations and others are using best practice and bring it back here. For context, I do want to say that we saw a couple of times of uptick in the Board of Health emails. And one was when school was going back in session in August. We had a tremendous, well, I shouldn't say tremendous, it was an uptick in the Board of Health emails for mask mandates and against mask mandates. And then the most recent was at the last Board of Health meeting, where there were a lot of comments from the public that were thinking that the Board of Health was considering a vaccine mandate. And with that email, we did reply and say that that is not the case. In no way, shape, or form is the Board of Health going to consider a vaccine mandate. It's purely to support vaccine and the promotion of vaccine. So that language was not in there. And then there was also emails for vaccine support, and then also, as you mentioned, Mr. Donaldson, some against vaccine as well. So those are the themes that have come through the emails, and during my public health presentation and director's report, I try to do a good job at knowing what some of the hot topics or what's going on in the community and provide some data and information for everyone to be aware of that. So I think it's a kind of a multi-pronged effort as it relates to some of the information that I'm providing with my team, and certainly happy to do a process change. Yeah. I think that I welcome that, and I think that that's an easy fix.
Chair would like to make a comment. Valuable input and we had requested input from all of the board members about this subject, which, as I mentioned earlier, our health department is making some quick turns on this. And Susan, correct me if I'm wrong, it's been since early November, maybe November 1st, that all of the emails from the public get to all of the board members all of the time. And we need to recognize the change in that policy driven by the fact that there's just so many more folks who would like to comment about health department policy. And I would say that there is a caveat to what Councilmember Donaldson is saying, is that in the bylaws there is a provision that says individual board members may comment on policy, but it's important that they make sure that the public knows that that's their individual feeling or policy, and not try and represent the board. So I think we've got a couple of avenues to go down. I would like to have some consensus about what the board feels about various items. It is something that is being worked out here now. I think at our next meeting in January, having experienced now 2.5 months of additional emails from the public, we'll have a better idea and we can discuss it further at that time. But I wanted to say thank you for being so responsive. Thank you to your staff. And I think that the way you're handling it right now is good, and it perhaps can be better. But I think we're learning a lot of lessons from, as you say, research out to what other organizations are doing, so that we can have a best practice or a best model. So all the emails go to all the board members all of the time. That's the current situation. and you're still refining those processes, and we will take additional input from board members and press on. We want to hear back on this subject in January, please.
Okay.
Okay?
So
Mr. President, I believe Mr. Collis would like to speak.
Yes, please.
Susan, thank you, and want to thank Councilman Donaldson for bringing up this issue and letting us see these emails. In the last month or so, or 2 months since we've been seeing them, certainly they're not overburdensome to read all of those emails that we're receiving, so I appreciate the heads up and look forward to, thank you for the change that your staff put into place, and look forward to hearing from other board members moving forward. Maybe in January we can put resolution to it, come to a consensus, and have a policy developed that, and I appreciate the fact that other county health departments will be looking at us to lead the way on this and kind of set the standard for how we should communicate with our public.
Okay. Any other comments? Yes.
Yes, sir. Mr. President, you mentioned that, well, we're going to change this policy because we're receiving more emails now. I think this policy is being changed because I brought it to your attention. Other than that, I think it would have just stayed exactly the same. The county commissioners, because they receive emails through their own county commissioner addresses, weren't even aware this is how it was done. In fact, I understand Ms. Kilroy would understand because she was a former president. So, in fact, it's really not Susan Whelan's decision on how this is done. This reflects on the president and the former president. And I don't think there's any way to say, oh, that's fine, or that was a good idea, that when citizens try to communicate with the Board of Health, those emails don't go to the Board of Health. And one more thing is when you say, well, it's important that citizens know if you're speaking, it's personal and not as a member of the Board of Health. Is that what you said? Mm-hmm. I have here your letter from Dr. Jim Turbush. We are learning the wrong lessons from COVID-19, which I printed off from the CS Indy. And after your sentence, which says, to reject COVID vaccines is not only anti-scientific, it is selfish. So if any of you don't accept the vaccine, you are selfish. It is at the very last line on here says, James Turbush, MD, MPH, is the El Paso County Board of Health President. So does that make it clear that you're speaking as yourself and not as a member of the board?
Councilmember Donaldson, I'm glad you brought that up because, yes, I did say that word in a meeting. And here's the context. I said that word, which is to
Mr. President, right now I'm talking about...
I have it in front of me. I have it in front of me. To reject the COVID vaccine is selfish, meaning a selfish act. And I wrote later in an email that I could have chosen perhaps a better word. But since you brought it up, here was the context. I was worried about the future, and I said that we were learning the wrong lessons from this COVID pandemic. I said that the scientific method has been around a long time, and it's proved its worth. The scientific method typically requires peer review, transparent procedures, analysis of multiple cases in several different studies, and is reproducible. I was trying to make the point that from a public health perspective, vaccines protect the person who receives them, but also protects persons who cannot or will not be vaccinated by decreasing the amount of virus circulating in the community. And this holiday season, we're seeing this being played out in families across the country. Elderly persons who are most likely to die from COVID because of comorbidities are reluctant to gather with unvaccinated younger relatives. The COVID vaccines are good but not perfect. There are other persons taking chemotherapy, for instance, who cannot get the vaccine. My point is that when you get vaccinated, you help yourself and you help others, and that should not be too hard.
Dr. Turbush, can I have a comment?
Dr. Vu.
You know, I wanted to remind our board members that our responsibility here is to protect the health of the public. Each one of us may have slightly different ideas of how to do that, But the best way to do that is also to protect the unity and the cohesiveness of our board. So I wanted to remind our board members to keep that in mind, please.
Okay. And this may be my final statement. My concern with this letter, besides that one sentence, is at the bottom of it, it says, Jim Turbush, El Paso County Board of Health President. It doesn't sound like it's your personal opinion. It sounds like it's your opinion as the president of the board, which you just a moment ago addressed that, hey, we should be very clear not to misrepresent ourselves if we speak.
This point of clarification, Councilman Donaldson, it says Jim Turbush is the El Paso County Board of Health President. It's not signed as such. It is, that's put in by the...
That is correct. But I think for citizens reading this at that website, it would appear that help. This is a statement by the President of the Board of Health.
I think I made my point is that I was talking about science. I was talking about the ability of vaccinated persons to not further spread the virus, and that there are people in our the situation. Another situation that's happening right now is that we have perhaps young people who are vaccinated who want to have Christmas dinner with their elderly relatives who are not, and yet the risk there is interfering with family get-togethers and the social structure. That was my thinking on that.
And Dr. Turbush, I'd just like to say, Councilman Donaldson, Susan Whelan and her team did implement getting us all the emails that the public sends in the last couple of months when you brought it up, and I've been reading them. Haven't needed to reply because again, I don't feel like that. I can reply, but my reply might be different from yours or Commissioner Brimmer's. And I think again that when we reply, we need to still say you can reply as an individual, but as a board of health, I don't think you can speak for all of us when we haven't discussed those. So I think there has to be a different process in place. And I look forward to hearing what Susan has to offer up in January. And I think we probably deliberated this enough and we need to move on. Thank you.
Okay.
One point of clarification for Susan. It hasn't been 2 months the emails have been forwarded to us, Susan. Hasn't it been a little over a week?
I can look into it. I honestly, I'm so busy. That detail right there. But as soon as we spoke, I took quick action and to see what we could do and know that it's a process that I need to follow up with county IT and get all of that organized. And as soon as we could do that, we did that. And also with archiving the emails, we've been archiving the emails and steadily working on that as well for full access. So I have taken your input and your guidance seriously. So it's going to be an easy fix. We can figure this out. And I'll take the board direction and I will come back next month with a policy and see where you would like to direct me to with the Board of Health emails.
Dr. Turbush?
Yes.
A quick question, if I may. Susan, while you're researching that, can you? I don't remember when that email started. Could you look into when that actually started? Because I'm thinking it wasn't all that long ago, but I could be misremembering.
Mm-hmm.
Thanks.
In COVID time and with how busy we are, I just need a little bit of time to look back on emails. I don't have that off the top of my head.
Okay. Well,
so may I move on to my COVID update?
Please.
If that's okay. So I have a couple of updates, regarding some hot topics or what's been in the news, Omicron. Dr. Urbina is going to provide an update about Omicron and where we are with El Paso County. And then before we get to the Omicron and then the other data update and what's happening in El Paso County, I am going to start off with a update about schools. As you are well aware, and we've had numerous meetings where we have provided school updates and also had a superintendent come to the Board of Health meeting and talk about the work that we're doing, as we work very closely with the 17 different school districts and have had meetings with the Educational Alliance and COVID coordinators and nurses as we took on a process to narrow in on mitigation efforts in schools, and the school guidance will be effective after December 17th, and we timed that in line with the authorization of the 5 to 11-year-olds vaccine. My deputy director is going to give an update, but I did think it was important that I provide an update on that as we to connect the dots from one of our last meetings. So with that, Deanne Ryberg, could you provide a brief update around school guidance and where we are?
Good morning, Board of Health. Pleasure to see you all this morning. Deanne Ryberg. I serve as the Deputy Director for El Paso County Public Health. And I'm here this morning to represent some of the work we have been doing very closely with our school partners. As Susan mentioned, we have been meeting regularly and routinely with school leaders. This includes individuals who fill the role that we term COVID coordinators, who are the operational leads of the schools' response to COVID, our school nurses, as well as superintendents and leadership from public, private, and charter schools. As we've had these conversations, needs that we have discussed with the schools have included being responsive to the taskings around health, safety, and academic progress that fall to the schools, and concerns coming forward from school leadership about responding to co-occurring important needs for the school environment that include the physical health and safety during the COVID pandemic, the social emotional welfare of children having mental health impacts during this time period, as well as the academic progress that they are charged with supporting our students in the El Paso County, as we are now in 3 academic years that have been impacted by COVID. So those are some of the concerns that have been prominent as we have planned forward in the COVID response and worked with partners from the schools community to plan for the next phase of the pandemic response. During this phase, our intended focus is to be on targeted and sustainable mitigation strategies that help sustain both the school operations and academic progress while still providing safe and healthy environments for our students. So in order to move forward with this, we convened a work group of the Pikes Peak area superintendents to help inform our school guidance to move into this next phase. We also met with COVID coordinators, again, those operational leads of the schools and school nurses, to seek their feedback, as well as members of the Educational Alliance of Colorado representing our charter school partners, and solicited their feedback regarding a new phase and a new path forward for our COVID response in schools. All their feedback was taken into consideration as we charted this new path, and I would just like to highlight what I feel is one of the most important operational changes that will come with this new guidance, and that is a shift in our approach to quarantine. To this point, quarantine has been a standard approach for close contacts in the school environment, and we have heard from our school partners repeatedly about the operational burdens that come with that approach to quarantine, as well as the academic disruption that impacts children in our schools. So moving forward, the quarantine approach will no longer be focused on a a more blanket approach, but we anticipate targeting high-risk situations that include household contacts to known COVID-positive cases so that we can still enact quarantine in those important situations, as well as having quarantine as a critical part of our mitigation strategies in the school environment. So with this new guidance, we anticipate that it will go into effect, as Director Whelan mentioned, October 18th. This timeline was also an element that we sought feedback from our various stakeholders in developing the timeline and the path forward. We arrived at this timeline in part because this allows time for the necessary training, communication materials, and coordination for a county-wide response to occur so that we are moving forward in close coordination with our school partners. We will be putting this in place at the beginning of winter break for most of our schools. That will allow our school partners to come back after winter break with a coordinated plan for the new year as it relates to the COVID response. It also coincides with information that we were receiving regarding anticipated peaks in the fall surge related to COVID, and anticipating that those numbers would be receding as we approached winter break, and our data team will be providing updates regarding our current county metrics. And then also importantly in making this decision, the 5 to 11-year-old age group became eligible for vaccine in early November. This timeline allows those families who wish to pursue vaccination for their younger children to make those plans, consult with their healthcare provider as needed, and have time, if that is their decision, to have the full effect of the COVID vaccine for those age groups, with this being a 2-dose series separated by 21 days and 2 weeks post the second dose to have full impact. So those were many of the factors that went into developing this timeline as we implement this new guidance. And we hope that moving into the 22nd month of our COVID response and into 2022, this charts a more sustainable path for our school partners in COVID response activities. And I would be happy to take any questions regarding this.
Any questions from board members for Deputy Director Deanne Ryberg or
I did want to add,
Whelan.
in addition to what Ms. Ryberg has mentioned, is that we, in working with our partners, we offered a mobile vaccination van that would be able to provide vaccinations, and we've worked with District 49, District 2, District 14, and there were many mobile vaccinations that were provided, and also with parent consent with providing those vaccines. So that's in line with the timeline.
Just wanted to remind the folks who are here that there will be ample opportunity for public comment. In fact, 2 times we're going to have public comment immediately after we discuss the resolution in support of voluntary COVID vaccines, and then again at the end of our meeting for any other or additional topics that we didn't cover already. So we'll have plenty of time for feedback. We've got it in the schedule. Okay, go ahead.
I'd like to have Dr. Urbina come up and give us an update on Omicron.
Thank you again, President Turbush, and also members of the Board of Health. I always appreciate coming to boards of health because you guys do a great job, and I appreciate all your voluntary service. I'm here to talk a little bit about an evolving science. Omicron is new to the world, and as you know, it first appeared in southern Africa at the end of November, and we're still learning a great deal about it, as we have over the last 20 months about the evolving variants of COVID-19. So I want to put that as a reference because something we know now may be not true in the future. As we learn about science, Dr. Wu understands this and Dr. Turbush understands this completely, we are learning as we go along. It appears that the Omicron variant appears to be as contagious as the Delta variant. very contagious. So that's important to note. It's same contagiousness, same respiratory droplets, same aerosolization, but early on, we think it may be less serious. But then that's part of that is because it's been shown up in younger people, previously vaccinated, people that have had previous infections, as well as the unvaccinated. So we're still learning what that means in terms of the Omicron virus. So stay tuned in future Board of Health meetings to hear more information about that. We also know that the preliminary studies related to the Pfizer vaccine as an example, not only Pfizer vaccine, but other vaccines as well, is that 3 doses are likely to neutralize the virus in human beings. Now that's still yet to be proven, still yet to be studied. A lot of companies as well as researchers are looking at the effectiveness of vaccine of the new variants, so more to come on that. It's still important to know that if you haven't been vaccinated, it's important to get vaccinated. It's also important to know that if you have only 2 doses of the vaccine, that 3rd dose may help you with not only Delta, but also this new variant. We know in Colorado there are 3 cases, but in the country there are over 30 states that have the new variant. Finally, I want to end by saying all the protective factors that we've talked about, and I know Dr. Johnson has done a good job of talking about protective factors, are still important in protecting all of us against the variant. And that begins with vaccination. It includes facial coverings. It includes physical distancing from large groups. It also includes targeted quarantine, as Deputy Director Deanne talked about, and isolation. It also includes not going to work or school if you're sick. So all of these layers of protection are going to be helpful in protecting you, whether or not it's the Delta variant, which is still the predominant strain in Colorado, but also for future variants like the Omicron. And so I'll be available for answer questions now about Omicron, as much as we know, as well as for future presentations, just to be available to answer your questions. So thank you very much for me giving you at least a brief blurb on Omicron. I look forward to your questions.
Thank you, Dr. Urbino. Any questions from board members?
Can I have a question for you? Can I ask you a clarification question? Thank you for talking about the Omicron, but for COVID-19 in general and the vaccines. If someone has had COVID infection and has natural immunity to the virus, would there be additional protection if that person also gets vaccinated?
Great question. Mr. President, do you want me to address
please.
that now?
Yes.
Dr. Whelan, is that okay? Director Whelan, sorry, did I call you Dr. Whelan? Director Whelan. There have been good studies now, Dr. Vu, that show that, and we didn't know this early on because we didn't know the quite longevity of the immunity associated with previously infected individuals. But there's multiple studies now, and I'd be happy to share those with you, that have shown that the vaccine starts to wane at about 6 months. It's also true about waning immunity based on the previous infection. So the whole idea about natural infection being a lifelong protection is simply not true. And there have been lots of studies associated with that. So that's why we're recommending that people who have been previously vaccinated get another booster, as well as people that have been previously infected also consider getting vaccination, because it ups their level of neutralizing antibodies as well as other protective factors that protect you from getting reinfected, because we're seeing a significant number of reinfections associated with previous infections.
Thank you for clarifying that. Can I, in addition to that, I apologize, can I ask you another clarification question? The question is, what is the advantage of a booster if someone already has 2 doses of vaccine and is fully vaccinated? Why would someone need another booster vaccine dose?
Mr. President, can I answer that question as well?
Please.
Great. So, great question. The good news is we've been following the people that have graciously volunteered to have vaccinations over the last 2 years. And so prior to having the FDA approve emergency use authorization, we've been able to follow these people over a period of time. And what we discovered in those individuals, regardless of the vaccine, mRNA or Janssen, the adenovirus vector vaccine, we've discovered that that vaccine starts to wane, like the waning protection from the previous infection that we talked about, Dr. Vu. So by adding another booster, it actually boosts not only the neutralizing antibodies, but other protective factors that actually reduce the likelihood that you'll be reinfected, or what we call a breakthrough infection with previously vaccinated individuals. So that's part of the idea, and they've been shown in these clinical trials in those folks that volunteered that actually have the boost of those neutralizing antibodies. So it's well demonstrated that it is added additional protection.
Okay.
Thank you, sir. Thank you, sir. This
you.
is such a great discussion. Can I just ask one last question? I apologize for that. So then the other question that is not very clear is if I were to get the vaccine, I would protect myself from severe disease, hospitalization, and death. But me getting the vaccine, would that also protect the people around me, my family members, people that I am around?
Yes. The vaccine does reduce the amount of infection and viral load in an individual, so that if you're vaccinated, it doesn't, no vaccine is 100%, and no previous infection is 100%. So by getting a vaccine, you can actually reduce the likelihood that you'll spread that virus to another individual. So it's a good idea.
Thank you. Thank you for explaining that to me.
Okay, yes, Councilmember Donaldson.
Yeah, a couple more questions if I could for the doctor.
And I also wanted to note that we will be going through some other data as well on COVID.
Thank you, Dr. Urbino. You know, you mentioned, if you get immunized, you reduce the chance of spreading the virus, but you can still spread it, correct?
That is correct. Whether or not you've had a previous infection or vaccination, you still can get reinfected with the virus. That is correct.
And now that's an interesting point, because with a previous infection, someone with natural immunity, if they become infected again, has there been a documented case of them then infecting someone else?
Yes.
Okay. Can you provide that information to me? Because I believe the CDC, this came out in court documents, was asked to prove that, and they don't have a documented case of that.
Yeah, sure, I can share with you multiple studies that talk about the reinfection rate and the spread of that infection after that.
Okay, and I'm not, and you're clear on what I'm asking, not that if you have natural immunity, you can get infected again, but documented cases of them then transferring it to someone else. Because my understanding is that really isn't documented yet. And my understanding is that with, if you're immunized with Pfizer vaccine, your viral load can be as high as anyone else's.
I'm not aware of that. I'd be happy to read the literature that you've cited about that. So,
okay.
So please send that. We'll share that information. Okay. I'm happy to look at it.
Very good, very good.
Okay.
Omicron, has anyone died from that yet?
I don't know the answer to your question, but I would be happy to look at it. I think there have been cases in Southern Africa that people have died, as well as the UK, but not in the United States that I'm aware of.
Okay. The cases in the United States, are most of those cases in immunized or unimmunized patients?
We don't know the answer to that question yet. We're collecting that data as we speak, and I think Fadi may be able to answer some of that questions, but stay tuned for future Board of Health meetings. As we get that data, we'll be able to share that with you.
Because my understanding is almost all those people have been vaccinated, some of them triple vaccinated. There may be an explanation for that. Maybe the ones that traveled to South Africa had to be vaccinated, so that's why. But I think it's important to be transparent and honest with what we have.
Mm-hmm. Okay.
Is the Omicron virus weaker than Delta? I think you pointed this out, right?
We don't know the answer to that question.
Well, we don't know the total answer to a lot of questions, but what do we think currently?
I can't estimate that without looking at more data.
You mentioned, this is it, this is my final one. You mentioned that vaccine, the efficacy fades at about 6 months, and then you were kind of vague on when that happens with natural immunity.
Is that a question or a comment?
It is. Do you have studies which suggest it fades at 2 years, 3 years?
The data is all over the place regarding how long immunity lasts. There have been good studies that say the sicker you are with an infection, the longer your immunity lasts. Similar to what Dr. Vu asked about earlier, is that the more boost you have in your protection, whether or not it's vaccine or an infection, the longer your immunity lasts. So I think we're going to learn a lot more as we go through, but I'll share those studies with you so you can look at it and we can talk about it offline if you'd like.
Okay.
I appreciate it.
Thank you. Thank you, Dr. Urbina. Look forward to seeing you again.
Thank you, Dr. Urbina. I appreciate it. Now we're going to move on to some milestones, given the current date of when we received our first supplies of the COVID vaccine. And Fadi was going to go through some of our standard data updates for our board, and he is our agency's epidemiologist who also updates the data dashboard online. So Fadi?
Welcome, Fani.
Good morning, everyone. I can't believe no one has sent this yet, but Merry Christmas and Happy Holidays to everyone in this room. We may disagree on some things, but I think we all agree that it's a wonderful, wonderful time of the year. I'll be going through, my name is Fadi Okana. I am an epidemiologist. I'm here on behalf of our Office of Data and Analytics. I'll be going through some typical data updates for you that we typically do during our meetings. I'd like to reiterate our agency's commitment to data transparency. Our county put up a COVID-19 dashboard pretty early on to the COVID pandemic. We were one of the first counties in the U.S. to do so, and our dashboard does include a plethora of information. Our vaccine dashboard was one of the first to include federal numbers through a partnership that we achieved through our vaccine consortium. It's something that we're very proud of, and we continue to adjust and fix it as we receive more comments. And both of those dashboards are public and updated daily. Like Susan mentioned, we are hitting that 1-year anniversary since the very first shot in El Paso County. We're proud to say that since then, approximately 1 million doses have been received by El Paso County residents. We currently sit at 69% of the eligible population vaccinated with at least 1 dose. If you recall, we did hit the 70%. However, the denominator changed because the 5 to 11-year-olds were made eligible, therefore the percentage dropped. The fully vaccinated is just above 62%, and something that we're very proud of is that our high-risk group, the 60 and above, is at 80% fully vaccinated. I should mention that I'll be happy to field questions as I go through this. Dr. Urbina and Dr. Kelly will also chime in to expand on anything that I fail to do so. Some of the questions I may be able to answer, some I may not due to data limitations. Okay. An update on our incidents. We did hit a year high on November 10th, and since then, I'm happy to report that we're seeing a decreasing pattern. The graph on your screen or on your papers, that red circle is representing the most recent time. During Thanksgiving break, that's the decline that you're seeing, and that's typical of data lags. However, the good news is that since then, the incidence did not rise above what it was before Thanksgiving. On the bottom of the screen, you're seeing a daily average, a 7-day average of the number of cases. So we are in a decreasing pattern, but as you can see, we're still hitting more than 200 cases per day, an incredible number. So good news going into the Christmas and holiday seasons, but we do want to mention that the incidence remains at a high level. Next slide, please. I do want to include a screenshot of our public page that represents the number of hospitalization census that we receive daily. This is another incredible partnership with our hospital partners. Every day, they give us a number that represents their regional hospital census. We tally it up and we present it. The right hand of the graph represents the most recent time. You can see that they are still experiencing a high volume of hospitalizations. We discuss, the consensus of the group comes together and describes their capacity as a team. And currently, that capacity description is that the hospitals are strained, they're limiting adult surgeries and procedures, and they're experiencing resource limitations. That has not changed. Next slide, please. I wanted to give a little update regarding boosters. The graph on the screen, and apologies to the audience, it may be a little difficult to see. The orange color that represents the majority of the doses within the last 90 days, that's representing boosters. We've had more than 100,000 folks in El Paso County receive their booster. Our 5 to 11 population is currently at 15%, and they're tracking similar to that of the 12 to 17, where you see an initial spike and then a relative plateau as folks continue to get vaccinated. Next slide, please. We represent here a little bit of a summary data regarding the cases, hospitalizations, and deaths per month. Everything you see on your screen, everything that you've seen so far besides the regional hospital data has been of El Paso County residents. Dr. Turbush, during our November meeting, you asked, is November tracking similar to October, or is it different? Unfortunately, I have to report that the number of deaths in November did exceed October, 129 to 123. We typically see all these numbers all over the place. We like to represent the numbers per day. It's another way of looking at the data. During October and November, every single day, we saw 4 deaths a day. An incredible number to say out loud. A little bit of breakthrough cases within the last 90 days, as you see on the board and on in front of you. Every 3 of every 4 cases have been unvaccinated or not fully vaccinated. Every 4 of 5 hospital admissions were unvaccinated or not fully vaccinated. That point is consistent with what different hospitals have reported. UC Health has reported that publicly. And every 4 of every 5 deaths were unvaccinated or not fully vaccinated. That's within the last 90 days. Next slide, please. That concludes the data portion. We'll be going through some data with Dr. Kelly. Any questions? Yes, Dr. Vu.
Thank you, Fadi. In your slide, so the deaths that were reported were these El Paso County deaths from
Yes.
COVID-19. Can I ask you, are these deaths, in general, are they from COVID-19 infection, or are they from people dying with COVID-19?
Yes, I think Dr. Kelly will elaborate a little bit on that. He may be able to describe that better because of the autopsies that he sees. We see case numbers and we see death numbers. There are Excel sheets. He actually does the hard work to look at the autopsies.
Okay. Thank you. So in addition to that, do you have any data on how many deaths in El Paso County from people from getting the vaccine?
I believe we have not had a single death because of the vaccine here in El Paso County.
Okay. Thank you.
Any other questions for Fadi? Yes,
I do have
Councilmember Donaldson.
Can we go back one slide to the previous slide? Well, no, that was good right there. Slide number 24, the next one. So admissions, we have it broken out by vaccinated, not vaccinated at the bottom. Do you have it broken out by age?
Majority of the hospitalizations and deaths continue to be among the elderly, that's 60 or above, but the unvaccinated and not fully vaccinated tend to be younger, about 5 to 10 years on average.
Okay, because one of my concerns, which I'll express later on, is that we kind of have a blanket policy. Everybody needs to get the same treatment, but the risk is really concentrated. For example, from our website, make sure I read the right numbers here. Deaths in the 90-plus population, of which there are very few, 90-plus, 217 deaths. If I add everybody up from 60 years and below, there have been barely that many or not quite that many. So I would be interested to know that. As another data point is, if most of the people being admitted are elderly, and I believe they are, that's where the concentration of effort should be. And on this, deaths in the 0 to 9 age group in El Paso County, do you know the number for that?
I believe we've had 3 deaths of the 0 to 19.
Well, correct, but it's 10 to 19, because there are none in the 0 to 9. And in the 10 to 19 age group, it's very interesting to me if they're 19 years old or 10. And so again, for me, if we're going to encourage people to consider vaccination or get vaccinated, to focus that where the real risk is, and from 0 to 9, there have been no deaths, 10 to 19, 3, 90 plus, 217. So I guess my request would be to have this data on admissions with some age breakout into it.
We have, just to clarify, I just want to make sure that I would just like to clarify your request. On our website currently, we have age breakdown of hospitalizations. Do you mean going farther than that, or?
Nope. Let me take a look on the back of this. Okay. Historical, right? It just has the total number. It doesn't have it by month like what we have here.
Sorry, Councilman. On the left-hand side of the website, there's a date slider where you can navigate as you like.
And but I believe those bar graphs that are on the right-hand side of the slide, they stay stuck, right? It's like those are total cases.
They should animate as you change the date range. If they do not, we'll check on that, but I am fairly confident they do.
Okay. Do you know? Okay, I'll take a look at that. Thank you.
Thank you.
You're right. Thank you.
I did want to add, I think with your question around the elderly population, and I know that Commissioner Gonzalez, you have brought this up too, for high-risk groups. And I think it's significant that we've been able to vaccinate 60 years of age and older. And I think it's around like 86% of El Paso County's population. So I do think that's significant. And we also do work with long-term care facilities, which before COVID, we had not had a lot of interaction, but that is an area where we focus. And then we also work to offer vaccination. So I think that your point is well taken with the 60 plus and older, that is a major focus of our team.
Good.
Thank you, Mr. President. So that was going to be my comment, is because I did bring this up before, and so I didn't want to tie back to what Dave said. That I had made that previous request. So you have the general proportion for the entire population of hospitalizations and deaths, and my previous question was, because we are seeing it so much in the seniors, what is their proportion of unvaccinated, vaccinated for those most highest hit, so we can better address the most at-risk population? And I've asked that before, and I haven't seen the information.
Well, we'll get the answers. Yeah.
And Commissioner Gonzalez, as it relates to the hospitals, I did want to make the point too that the data comes from the hospitals, and it's the hospital data, and we can certainly look into that.
Can I? I'm sorry. Can I have another comment, please? And I do agree with Dave and with Commissioner Gonzalez. The older people are, of course, at higher risk for severe disease and hospitalization, death from COVID-19, and that's why El Paso County Public Health has initially focused vaccination, prioritized that to the elderly first. But if I interpret what Dr. Urbino said, in order to continue to protect those higher age people, in addition to focusing on vaccinating those people, we continue to recommend vaccination for younger people who are around those older people in order to focus on protection of the older people. Thank you.
Any other board member comments? Director Whelan, do you have a?
Well, I'd like to ask Dr. Leon Kelly, who is El Paso County's coroner, to join us and to dive a little bit more into some of the death data. But before we do that, I did want to mention, when you look at those death numbers and experiencing 2.5 deaths per day, and it is around the holidays, and I just wanted to extend my deepest condolences also to those who have died in our community. That's what we're trying to prevent severe illness, hospitalizations, and death. I mean, there are real consequences. And I just wanted to make mention of that because there are people in our community who have lost loved ones, and they're hurting. And I think that we need to acknowledge that, and especially around the holidays.
Okay. Dr. Kelly? Hello, sir.
All right, thank you for having me here today. I'm Dr. Leon Kelly. I'm the El Paso County Coroner and Chief Medical Examiner. First, to get to couple Councilmember Donaldson's questions. There has been only one death reported from Omicron, and that was a couple days ago in the UK. They have not reported whether that person was vaccinated or unvaccinated. As we know here in the US, the majority of those people who have had that infection have been vaccinated, but to your point, most of those people are traveling from other countries, and many other countries actually have vaccine mandates. So when we're talking about a country that has around 70% vaccination rate, which is ours, and then you're selecting really only people who've gone to these countries where it's mandatory, there's a base rate bias there that's who's gonna have it, because that's the only people that's been exposed to it.
And Dr. Kelly, do you know the numbers like on how many Omicron cases there have been in the United States? How many of them are vaccinated versus unvaccinated? I don't have that.
Yeah, so I do. It's around, as of a couple days ago, it was around, I think 80% were vaccinated, but once again, those are the people who've been exposed to it. It has occurred in people who are unvaccinated, correct. But the majority have been vaccinated because that's who's seeing it.
And then one other question, the one death in the UK, that is a person that died with Omicron. Did they, I'm sure, did he die from Omicron, or was this a cancer patient who, was very close to death and then he passed away?
Yeah, and that Boris Johnson, I don't have the phone number of the Prime Minister, unfortunately. So the media has reached out. He made a comment on a tour, and that they had their first death, once again, 2 days ago, and I have not seen anything where he's made any further comments detailing that individual. So all options on the table.
Yeah.
Okay. So I am going to give my perspective on where we've been and what's going on as the coroner and chief medical examiner. And it's going to be a little bit different than public health, but certainly some overlap. So by Colorado statute, by Colorado Constitution, the coroner is mandated to investigate all deaths that are sudden, unexpected, and non-natural. Underneath that umbrella is all deaths that constitute a public health threat or due to a contagious disease. Now, we know the vast majority of people who've died of COVID are doing so inside hospitals, inside long-term care facilities with known diagnoses and being treated by doctors and nurses. Those individuals are not going to come to the coroner, right? I'm only seeing sudden, unexpected, or situations where we don't know why they're deceased. And so when we look at all the people who've died of COVID, I'm only going to see a very, very small slice of that. But that slice, when you examine it, can be very illuminating as to what's going on. In Colorado, I speak a lot of community. I'm out there essentially every day, and I get a lot of great questions from community about who decides how many people die and how is this all tabulated. And when the CDC or when the state government says an individual has died of COVID, where they're getting that is from the death certificate. Everyone who is born gets a birth certificate. Everyone who dies gets a death certificate. What the state vital statistics and the CDC does is they collect all of those death certificates, and they look on those death certificates, how many of those have been listed as COVID, either as the underlying primary cause of death or as a significant contributor to death. And that's how we've always, for the last 100+ years, tabulated causes of death. And this is what a Colorado death certificate looks like. In Colorado, there's only two types of people who can sign death certificates, can certify deaths. One is as a physician, the two is an elected coroner. And I am only a couple in the entire state who is both of those things. And so this is data that's based on what is coming into my office only. This is what I am seeing with my own eyes. What you have to know about El Paso County's coroner's office is we're the largest in the state. The vast majority of El Paso counties do not have physicians as their coroners, what we call lay coroners. And so they can't do autopsies. And so what many counties do surrounding us is bring their bodies to us, people who've died of all of these things, And our doctors, myself and my colleagues, do the autopsy. And so my data really is regional data. It's about a third of Colorado are bringing those cases to us. And when we look at that, if we look back at 2020, if you look at my annual report, I had 13 total COVID-19 deaths that were El Paso County deaths that were citizens. In addition to that, I had 11 other either from the surrounding counties or deaths that had COVID as contributing factors, as well as other things, and I'll get to that in a little bit. So that's for a total of 24. So we saw last year 24 total COVID deaths in our office. However, once again, that's a very small portion of the people who died. These are the people who died at home, on their way to the hospital, or upon arrival to the hospital that did not get a diagnosis. So when we compare that, say, 2021, and that's where I'm going to spend the rest of my time, in my office, regionally, from El Paso County and many others, we had 54 total COVID-19 fatalities, okay? Of those 54, 49 or 91% of those individuals were unvaccinated. We had one individual who was partially vaccinated. And how do we know? We know because first we asked their families, was the person vaccinated or not? And two, I send the list over to public health, who then goes through the state database and decides whether that person was or was not vaccinated. 3 of those 54 deaths, so 5.5%, were in the vaccinated. Okay, so 91 to 5.5. I've got 2 folks that I was not able to figure out one way or the other. One was an inmate from Fremont County who died in January. I'm 99.9% certain they were not vaccinated, but I was not able to prove that, so I'm going to leave them in the unknown category. And then I had one individual who had traveled here from out of state, likely ill at the time, and then died relatively quickly, and so I don't have access to that database, and we didn't have family to talk to. Everybody else we were able to put into one category or another. So when we compare those 2 data sets, the unvaccinated versus the vaccinated deaths in the coroner population, the vaccinated were 72 years old on average. No one was under 60 I just promoted you, Councilmember Donaldson's question. 60, nobody who was vaccinated less than 60 died of COVID. Why 60? Why is that kind of the magic number that we keep talking about? Well, 60 is the age in which, one, some of those comorbidities start to stack up against you, but more importantly, that's kind of the age where the immune system, the robustness, its ability to fight off infections and injuries and any threat to the body begins to deteriorate. And so even in that population, even mild infections can be life-threatening. And it's not just COVID, that's many other things. Hip fractures can kill you, rib fractures can kill you, minor injuries and illnesses can kill you for that reason. And so we know that even in the vaccinated and or immunity acquired through infection, we do a good job, the body does a good job of limiting the impact, of decreasing the severity, even with breakthrough infections. But once again, even minor infections in those populations can kill you. In the unvaccinated, we had an average age of 55 years, so nearly 20 years younger, and an age range between 31 and 88. So once again, a very broad range. Now, this data is only through mid-November. It takes about 4 to 6 weeks for an autopsy report to be done. These are only the finalized cases. And I can tell you, this includes that number 31 is going to go down. I had a man die on his 30th birthday a couple weeks ago from COVID. I've also had, in the last 2 years, 2 law enforcement officers who've died in the line of duty from COVID-19. And as a man whose job it is to have difficult conversations every single day with family, those were 2 of the hardest ones I've ever had. And these numbers, and on Monday, we had 17 cases, 17 autopsies. We had officer-involved shootings, we had homicides, we had a plane crash, we also had 5 suspected COVID cases. And so this is the daily work that we are seeing. So that number is going to go up, and that age range may change, but that's where we are right now. And breakdown, I think that's a critical piece of this. Once again, small slice of the pie, what we're seeing at the coroner's office. But through mid-November, I've had 6 individuals die in their 30s, 12 in their 40s, 15 in their 50s. That's essentially the opposite of what we see when you look at the overall age distribution, which generally is more 60s, 70s, and 80s have the peaks. Once again, that's because my patient population is different. So the primary underlying cause was COVID. It was the main number 1 thing that killed these people in 45 of the cases. In 9 of those cases, Yeah. Yep.
Dr. Kelly,
So we've had more deaths in the younger population than the older population?
In the coroner's population, yeah. So the people that come to me are going to generally be younger.
Oh, okay,
Yeah.
got it. Okay, that's a question, because, okay, it told me, threw me off. 'Cause
Yeah,
it was
yeah,
like,
yeah.
that's opposite of the...
That's
okay,
opposite of
got it,
what we
got it. Thank you.
traditionally think.
Now I understand.
Yeah,
Okay.
and thank you for reminding me, because I wanted to speak to why that is.
Thank you.
Thank you.
Mr. President, can I ask a question at this point?
Go ahead.
Are you going to address comorbidities at some point?
Yes.
Okay.
Yeah.
All right, I'll
Next
wait for
slide.
that.
Yeah. So the reason why this population is different, what's happening here? Why are you people getting COVID and then not going to the hospital and taking the traditional route? And why is my population skewing? What did I say something funny?
Come on now.
What did I say? Okay. So why is my population skewing younger than what we normally see in the hospitalized population? And that's because generally, most of us believe, and it's true, that younger people are not as impacted by this, because that is true nearly across the board. However, that's not always going to be true with this. And so what a lot of these folks are, they're people who are trying to stick it out at home, right? Their symptoms are relatively mild. They're doing pretty good. Some of these people have taken home antigen tests. They know they have COVID-19. And so they stay at home. And for the first 7 to 10 days, they do pretty good, like most of us do when we have viral illnesses. But unfortunately, in a select population of people, they can deteriorate very, very rapidly. And that's what the majority of these folks are. They're folks who were at home and didn't choose not to go to the hospital for one reason or another. Many of them then deteriorate quickly, and then their family is beginning to take them to the hospital or calling 911 before they die. Some of these folks are folks who are outside of the normal kind of healthcare system. Maybe they're homeless, maybe they're indigent, maybe they've got other problems going on and they don't utilize doctors and nurses in the hospital system. And so this is no different than every other illness that they've ever had. And then some folks just, because we're humans and we're complicated, are just obstinate. I'm not going to the doctor because I don't think I have COVID-19. And I don't want to go there where they're going to kill me because I do. And we've had family members tell us that was the issue. They just did not want to go, no matter what. Ooh, let's go back. There we go. So, next slide. Once again, I think I got through this. Primary underlying cause, 45 times. Significant contributing factor to death, 9. So they had other significant things going on, and COVID-19 was just kind of the thing that sort of tipped them over the edge, like we think about other diseases, such as diabetes and obesity and other things. The mechanism of death, pneumonia and respiratory complications are the predominant issue in most of these. They get sick, they get cough, they can't breathe, they deteriorate, and then they die. However, in some of these folks, 5 of them involve pulmonary emboli, which are blood clots that develop in the vasculature. One of these little pieces can break loose, go to the lungs, and block off blood supply. And those are very dramatic, sudden presentations. These individuals may be relatively healthy filling a home, maybe a little bit of congestion, maybe a little bit of cough, but they're doing all right until this happens. And then they have a very rapid, sometimes they're only moments, seconds before they die. One of the cases had a co-infection with adenovirus, which, like traditional coronaviruses, is relatively minor. You can imagine if you have more than one infection, it's not going to be good for you. And then 3 cases involved individuals who were actively ill with COVID-19, but then were also using and abusing substances or drugs. And if that doesn't encapsulate what life is as a medical examiner coroner and the challenges that we are facing, I don't know what else does. The most common contributors to your question: obesity, cardiac disease, hypertension, atherosclerotic cardiovascular disease, and then chronic alcohol, which would speak to that one group that I talked about that doesn't generally seek care in the traditional medical system. But 30% had no comorbidities listed at all. Relatively young, relatively healthy. This is what a normal lung looks like, and I presented this to BOCC previously. These are what we call the alveolar air spaces. This is where the air comes in. These are the alveolar walls. These are where the gas exchange happens between the air you breathe, oxygen goes into the blood, carbon dioxide goes from the blood to the air, you breathe out, and the process starts over again. This is what healthy lung looks like. And this is what someone who dies of COVID-19 pneumonia looks like. And so we see lots of hemorrhage in here. We see lots of what we call mixed mononuclear cells, fancy word for an inflammation inside the lung. And you start to see some of these pink things here, and I'll talk about those in a minute. This is once again healthy lung. These are single-celled walls. This is the blood that's going through here. These are where the air is. This is where the air goes over into the blood. Young, healthy, happy lungs that we see here. This person died of something completely unrelated to infection. And this is COVID-19 at that same power. Lots of blood, lots of what we call hyaline membranes, which is dead cells and protein. This is like concrete that sits inside the lungs. This is the reason why individuals can't breathe. They become short of breath. They require ventilation. They require oxygen. If you survive this, which the majority of people will, not to this degree, obviously, but a COVID-19 infection, these are also the reasons for long-term consequences. Sustained shortness of breath for sometimes many months is because these are scarred. The body has to now repair itself and heal over time. And in the majority of cases, it does, but these symptoms can persist for a very, very long time. And so in these cases that people come in, they're sick, we believe, or their family believes, based on their symptoms and what we find at autopsy, that they've died of COVID-19. Generally, what will happen is we do a full viral PCR panel. There's been a lot of questions about whether doctors are actually looking for all things, or are they only jumping to the conclusion of COVID-19? And this is what that looks like. Sure enough, we do. We look for all significant viruses, and in this particular case, only the COVID-19 RNA was detected, meaning that virus is present and is ultimately the result, as the cause of that underlying issue. And so, over the first half of 2021, we had 4 of 24, so 17% COVID-19 fatalities were non-El Paso County, meaning they came from the surrounding areas. 9 of 30, or 30%, came from the surrounding areas in the second half. So we're seeing a little bit of movement of the virus in these sorts of situations out into our rural areas, likely driven by lower vaccination rates there. The major points is for the unvaccinated. They're the overwhelming majority of the coroner-investigated COVID-19 deaths. All but 3 of them were unvaccinated. They're younger at death by nearly 20 years. And when we look at that, less than 60, people with robust immune systems and the ability to respond to the vaccine, we've had no deaths in the vaccinated individuals versus 33 in the unvaccinated. And so, look, I get it. I get that a lot of people are coming to this issue with strong feelings and their own personal history and the well-earned rights of autonomy, and I'm never going to tell you to do something other than what you want to do. But for me, my perspective as the coroner, where I sit every single day when it comes to my personal decision, the score's 0 to 33. To me, that's not complicated. It's pretty simple. And so when we get to the question at issue, which is, do the vaccines work? Are they effective? And would I recommend them to another human being? The answer is clearly yes. And so that is coming from what I see every single day. Everyone's entitled to their own opinion. My job as the coroner is to come here and give you the facts as I see them and allow you to make the best decision for yourself. That's all I got.
Dr. Cowley, can you please go back to the slide of vaccinated versus unvaccinated deaths, please? Perfect, thank you.
This one?
Yes, thank you. So when I look at this, I see that 3 of 54 deaths were vaccinated, and I might interpret this as, 3 people died unnecessarily. They were vaccinated and they still died. And I might interpret this as, the vaccine does not prevent deaths from COVID-19 and the vaccine does not work. Can you explain that to me, please?
Yeah, so we got to understand, whether you got infected or you got a vaccine, the purpose is to prepare your immune system for future onslaughts. There's when it comes to infected or achieved immunity, there's never been a debate that natural derived immunity works. If it didn't, the vaccines wouldn't work. It's the same process. It's preparing the body to do this. However, not everybody's immune system is prepared, is no matter what we do, is going to be able to combat this, particularly when you're talking about people who are sick and older. And so when we look at that and we say, well, 3 people still died while vaccinated, yes. In El Paso County in 2020, 41% of those who died in motor vehicle crashes did so while wearing their seatbelt. Nobody would argue that seatbelts aren't useful, that they don't work, because we do know they work. They reduce the risk of death by greater than 50%, especially used with modern airbags. No mitigation effort. Nothing is perfect. Nothing is foolproof. Nothing is fail-safe. None of this is about preventing every single death. We've never been able to do that. We're never going to be able to do that. It's about limiting risk, and that's it. It's about making good choices for yourself that limit the likelihood of death. And there's lots of ways that we can do that, but the vaccine is one of the most useful tools that we have. We live in a time where we should feel blessed and fortunate that we have these many tools available to us. And over the coming weeks, we are getting more tools that will allow us to limit and prevent the worst case scenarios here. And so, yeah, you can still die. You can do everything right and still die from this. We can do everything we tell you to do and still die from this. That's life. Like, that's how it works. And so make good decisions and do the best thing for you and your family.
Okay.
Thank you, Dr. Kelly. So it sounds like the strategy is to limit risk. Nothing's 100%.
That is the life of the medical examiner, trying to tell people not what to do, but giving you the best option at making the best decisions. But we're complicated, so sometimes we don't.
Another question, Commissioner?
Thank you, Mr. President, because I really haven't been able to get this answered from my requests during hospitals. But with deaths, do you have any information on if any deaths were in individuals who had previously been infected and then reinfected, so basically natural immunity, and then died when they received it a second time?
That's a great question. And the truth is I know why we think that's important. And for a subset of the population, particularly those who have been infected and then are deciding whether they should be vaccinated or not, that's an important issue, right? That's a huge issue. Is there really a benefit? Is it going to do us any good? Do you really need it? The truth is that's a difficult to essentially impossible question for me to answer. Why? Because how would I know if you were infected before? One way is to look at the database and see who's had a positive test in the past. And I will do that at the end of the year to see what that number is. But that number doesn't really account for everyone who's had an infection, because the people who had it, who never got tested, are going to show up here in my database as people who were never infected, and yet they were. And so I don't like to give numbers to just simply answer questions, even if they're good questions, if I can't stand behind what those numbers mean. And so my question then back would be, why does it matter, other than the people who we know have been infected and are trying to make that decision about whether it's worthwhile to get vaccinated? If the question is should someone, the average citizen who's not vaccinated and doesn't know if they've had it or believes that they haven't had it, should they get the vaccine? Like, that's really the crux of the issue. And that's really what's at debate here today, is should we encourage the non-vaccinated and people who have not been infected to get the COVID vaccine? And let's say that in my 49 cases, let's say all of them had previously been infected. Now, I guarantee you with my life that's not true, because everything about immunology would be false if that were true. Let's say all of them had it before. Well, we're in trouble because we really are depending on those people from the beginning to have immunity. That's what we talked about from the beginning. Slow the virus, have it move through the population, and then those people can buffer the people who haven't until we get to a vaccine. That was the strategy, okay? And so if all of them have now gotten reinfected and died, we're in trouble, because natural immunity is going to fail, vaccines are going to fail. We don't have any evidence to believe that right now, right? So we would then have to encourage those people, get vaccinated, because the booster will help you, is likely to help you, because the natural immunity is not working. Let's say it's the other. Let's say none of those people have had previous infection. Okay, none of them. Every one of them, this is the first time they've seen the virus. Okay, then what would be our decision? To encourage people to get vaccinated. Either way, encouraging people to get vaccinated is the strategy to reduce the worst outcomes. And so, yes, natural immunity has importance. It's powerful. We wouldn't survive as a species if it didn't work. But at the same time, if you can continue to mitigate that risk, because we know vaccine-mediated immunity and natural immunity will both wane. It will do it in this virus, it does it in others. And so your best option, not guarantee, is to prime your immune system in preparation for what's eventually coming. And every one of us has been exposed or is going to be exposed to this virus. It's just a matter of how prepared you are when you are.
Okay, Dr. Kelly, let's try and tie this up. I see people getting restless. We've been going about 2 hours. Councilmember Donaldson.
Can we go to the last slide? And Dr. Kelly, I want to thank you for bringing some nuance to this conversation, because this is what I agree with you that, say that carefully. What's my concern, I'll start like this. My concern is in a while, we're going to consider a resolution to basically, with a broad brush, recommend vaccines for everyone. But even in your slides, and this is a limited, subset of people, what was the youngest person that passed away here?
31.
31.
Well, it'll be 30 it'll be at least 30 by the end of the year. In this subset, I think I got 31, but it'll be 30.
Okay, so 30 years old. Mm-hmm. But in our resolution, we're recommending vaccines for 5-year-olds. Obviously, there are no 5-year-olds, 6-year-olds, all the way up to 30, 0. But we're recommending the vaccine for them also. Are you aware of any side effects with the vaccine?
I have had no fatalities seen in my office.
But I mean, you're a doctor.
Every medication, yes, there are side effects of vaccines, like every medication.
Especially in younger patients, is that correct?
Yes, younger patients can have side effects as well.
And again, that is where I have tried to slow this down and say I can't support this because we're, with a broad brush, recommending it for everyone. What's the number one risk among the younger folks that we know of now?
The number one risk of vaccines would be, an allergic reaction, anaphylaxis, yeah. That's going to be the most common complaint. Side effect is going to be soreness in the arm, potential allergic reactions.
I'm talking serious risks, though. My understanding, it's myocarditis is a serious, real risk for younger kids.
Yes, there are identified cases of myocarditis in people who've received the vaccine, yes.
And so my concern is, it's called risk stratification, is we recommend the vaccine for those who are at serious risk from it, and maybe for younger kids who have a comorbidity, a pre-existing condition, pulmonary fibrosis, but not blanket, everybody should get the shot. In Germany, their board that recommends immunizations does not recommend immunizations for all children 5 through 11. It's only for those with comorbidities or only those who are living at home with say, a parent who has cancer, with a very old relative. And that is the nuance, which you were starting to bring this to this conversation, that this isn't an equal risk for everybody. It's different. So thank you for doing that.
Okay.
Dr. Turbush, can I have a comment also, please?
Say something.
Okay, yes.
And I would say the case for Councilman Donaldson to encourage people to get vaccinated is because it is very contagious, and that if they're around other people, then it's going to be spread, even if the young child doesn't get it. And then also, as long as we're not vaccinated to a significant degree, then other variants will come around, just like the Omicron variant. And I think that that's my rationale in supporting it for everyone.
Okay. All right.
Dr. Turb.
Yes, go ahead, Kari.
Thank you, Dr. Kelly. I always learn a ton from you, so I appreciate it. Can you explain herd immunity? I mean, I have a general idea of what it is, but it's thrown around a lot.
So
Thank you.
there's two, you guys are the Board of Public Health. You're not the Board of Individual Health. And so your concern is the public. And that's what their concern is behind me. And what herd immunity deals with is public health, the ability for a population to control the spread of a virus or an infectious disease through it. The way that you do that historically is enough people get the infection that it does not travel so quickly that it causes everyone to die or many people to die at the same time. It's building barriers between those who have the infection and those who are at risk of the infection by putting people who've previously recovered from that infection in between there. The problem, which is good, that's how we've still survived all this time. The problem is with herd immunity is what's the cost in a natural setting? How many people have to get it and die before we get enough people who've survived to help limit that spread? In previous populations, 90% of Native Americans were wiped off the face of the earth because of influenza and smallpox, right? Half of Europeans died during Black Death because of infections. And so the cost is great in many cases, depending on the type of organism. We have yet to ever eliminate a virus from the earth through natural selection or through natural immunity. Why? Because we make new humans every day. We make new ones who have not been infected. And so the only way we've previously in the history of the world been able to eradicate some of our worst ills, polio and smallpox, is through robust vaccination campaigns. And so both of those things, both natural acquired immunity and vaccination, have the ability to limit that infection. One comes with a pretty steep price. The other one doesn't. It comes with a price, everything does, but a much less price to the collective than what just letting something like this run through the population is going to do.
Okay, thank you very much, Dr. Kelly. What I'd like to do at this point, we've been going quite a while, and let's take a 10-minute break, and we'll reconvene at 5 minutes to the hour. Thank you. Unmute. Okay. Well, it's 11 o'clock. We've gone a little bit over on our break, but I want to again focus on getting to the public comment. Now, this next agenda item is been done every year in December since we had a Board of Health, and it is in the bylaws. It says the president and vice president shall serve a term not to exceed 1 calendar year, and you can be reelected. The board shall elect a new president and vice president at the regular meeting of the board each December. And two other quick things. Our secretary is our public health director, and thank you for the great job you've always done. And the treasurer for the Board of Health is the treasurer of El Paso County. So we'll go through this process, this procedure, and anybody know where Councilmember Donaldson is? We don't know? Okay. Well, we do have a quorum. Okay. So, and I want to remind everybody also that, well, like we began, that we're not going to do cheering and booing and clapping, and please don't interrupt. We want to go ahead and get through this as expeditiously as we can. So let's go to the first step, which is that the elections for officers for the year 2022. The chair opens the floor for nominations for president for the calendar year of 2022. Any nominations?
Hi, Dr. Turbush. I nominate you to continue as president. I think it's important, especially during this time with COVID and the pandemic. And you've done a great job as a leader and board president, so I nominate you.
Well, thank you. Okay, other nominations for president?
Can I second Doris's nomination?
You certainly may.
I second.
Okay. Any other nominations for president? Okay, come on down. We'll wait until you get here. Okay, the floor is open for nominations for president for the El Paso County Board of Health for the calendar year of 2022. And Councilmember Donaldson, you wanted to nominate?
I do. I'd like to nominate Ted Colas.
Okay. Do we have a second?
I'd be willing to second. I think he's...
Okay. Okay. We have a nomination and a second. Any other nominations? Well, I guess we skipped right over that, didn't we? I certainly, you're qualified to be president. Do you want to be president, or would you accept it?
Well, Councilman Donaldson, I certainly appreciate the nomination, and thank you, Lojinos, for the second. But at this time, I would respectfully decline that nomination and support you in another term.
Okay, thank you. Okay, other nominations? Okay, here's the way we've done it in the past, is that if it's unopposed, well, let me just make a quick comment. I'm still qualified to be the Board of Health president for one more year, as my term as a member of the Board of Health extends until March, April of 2023. That's when I will have served 2 5-year terms consecutively. I'm willing to continue to serve as your president. In fact, it would be an honor to do so. And personally, I would like to see this COVID pandemic through to the end, which will hopefully be in the next year. Any other comments? Any other nominations? Okay. We have in the past, when
Mr.
someone
President,
is yes.
May I make a comment?
Please.
I would just like to clarify why I nominated Ted Colas. And the reason I did that is I'm concerned. There are 3 things which I think are, in the most favorable light, just bad judgment decisions by the current president. One, at the last board meeting, desiring to have the vote on the resolution before citizen comment. That shouldn't be, that's just a very bad judgment if that's what it was. Number 2 is the letter which was written and posted on the CSND and also read during our meeting, which says that if you don't support the vaccine, you are anti-science and selfish. I don't think friends of mine who have had the disease and don't want to get a vaccine because they believe their immunity is as good are being selfish. I also don't think parents who are concerned about their 12-year-old son who's perfectly healthy and has risk of myocarditis are selfish. And then thirdly, is we've discussed it, is the email problem, which has been going on for years. So one of these is something that's been going on long-term. One of them is a letter which was posted to the public stating that a good chunk of our citizens are selfish if they don't agree with the vaccine. And thirdly was not just instinctively thinking that citizens should comment before we vote. Thank you.
Okay, thank you.
And Councilman Donaldson, I take exception.
Okay. Yes, we've addressed all 3 of those things previously. Go ahead.
I take exception to what you've said today. We have followed policies and procedures that have been in place since I've been on the Board of Health. We've never had these kinds of issues come before us, and I'm not saying it wasn't appropriate to have those public comments before our last meeting, but in the past, if you've looked or listened to any of our meetings, you'll notice that we have made decisions based upon what information that we have and before we take public comment. I'm not saying that that wasn't the right way to handle that at that meeting, but in the past, that's how we've worked, and we have followed protocols and procedures that were set in place.
Okay,
All I would just say,
And I'd like to stand by my second. I think Ted would actually make a great president. So it's no reflection on that, but I do stand with the second for nominating Dr. Turbush for another term.
The fact that citizens have not been allowed to comment in the past on issues we're addressing doesn't reassure me. That's just another sign that it's probably time for a fresh set of eyes, new leadership at the top.
No, that's just not the case. I take exception with that comment, Councilman Donaldson. They have had an opportunity to make comments. We've never had a weighty issue like this where that we've always opened for comments. That's not the case at all. And your protocol has been different than what we've done in the past. But we have had procedures in place, and that's how and the county attorney never said that we were violating anything.
And that is my point, that
President
our current
Turbush has done a
president's-
great job.
That is my point, that our current president's judgment in that instance was not good, was bad, and I believe a new set of eyes, fresh leadership would be good, and also to restore trust. Thank you.
Okay, Councilmember Donaldson. Chair would like to make a comment. I had mentioned earlier that this was going to be awkward, but we're following the rules. There have been 2 nominations, and Board Member Ted Colas refused to accept, and I have indicated that I would serve for another year. So at this point, we are to a vote. And the way we've done it in the past is with verbal assent, but if anyone objects, we do have the ability to do secret ballots. So a motion?
Do we have the ability to do a roll call vote?
We will, yes. We will do it that way.
Mr. President?
Yes, please.
I agree with Councilmember Donaldson that that he brings up valid points. There have been some concerns, but as I do with everybody that I have frequent disagreements with, I have taken those up directly with Dr. Turbush. And we've had our share of disagreements that we work out, and that he has proven himself willing to listen and take guidance and change direction often. And so he's not in an easy leadership role either. But I have seen his willingness to listen to his fellow colleague board members and to take a little bit of direction, and I think he provides a great deal of leadership and qualification to come in on that as well. And I think that, this is just to say that I think Board Member Donaldson's comments, he's not bringing up anything that hasn't also already been brought up, and I prefer to bring it up privately, and I think I've had a pretty good solution and success rate with that thus far in changing a lot of things, including how and when and that you all are heard before votes are cast, and that a little bit of the public process piece of this that the 3 elected members of this board deal with every day, and we frequently we know exactly what that public input process needs to be and what the transparency process looks like. Dr. Turbush does not deal with that every day, but he has certainly been willing to listen and learn.
Thank you. Okay, well, there's only one nomination on the floor, and there is, I've accepted the nomination. It's been moved and seconded. Let's do a roll call vote. And aye or nay or abstain would be the answer. Dr. Vu?
Aye.
Aye.
Ms. Colrow? Yeah.
Aye.
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 Hey.
Okay, so it's been passed, the motion is passed, so I would be pleased to be the Board of Health president again for one more year. Now, there's another step that we have to take, and that is to nominate a vice president and then to discuss that as well. And I would like to start off by nominating Doris Ralston, and she's been a great vice president, but particularly she's been very, very helpful. She's attended all the meetings, she reads everything, and she has many years, in fact, an entire career in executive positions, and is very solid when it comes. She's also the CEO and president of the El Paso County Osteopathic Medical Association. Is that
Colorado
close
Springs
enough?
Osteopathic Foundation.
Okay,
yes.
okay. So medical background as well. So I would like to nominate Doris for vice president. Would you accept?
Yes.
Okay. Any other nominations for vice president?
Mr. President, I would like to nominate Ted Colas.
Very good. Mr. Colas, would you accept?
I would support Doris in that position. Again, thank you.
Okay. All right. Any other nominations for vice president? Yes, sir. No? Okay. Well, then let's go around the dais again with a roll call vote. So the motion on the floor.
Mr. President?
Yes.
If I could speak, I'm sorry. Mr. Donaldson, I really appreciate the confidence that you show in me by those nominations. And for everybody, the reason that I am reluctant at this time is I'm fairly new on the board, and I'm still learning a great deal each and every time that we meet as a board. I do appreciate the support of my fellow board members, but right now is not the time.
Okay. So we have a motion and a second. The nomination for vice president is Ms. Doris Ralston. We'll do a roll call vote just like we did before. Aye, nay, or abstain. Dr. Vu?
Aye.
Correct.
Aye.
Aye.
Nay.
Aye.
Aye.
Nay.
Chair votes aye. So by majority, Doris is reelected, and congratulations.
Thank you. It's an honor.
And so I mentioned already that our public health director is with us. Per the bylaws is our secretary of the Board of Health, but I think she deserves a little bit more than that. She has done a fantastic job over the last year, and in fact, we passed a resolution in June of this year commending Public Health Director Susan Whelan. And I'm not going to read it, but I just wanted to let everyone know that at each and every turn, my experience, my personal experience, watching Susan work and direct her team has been, well, marvelous but intuitive, and it turns out to be near genius in my estimation, and I enjoy working with Susan and her team. So thank you very much. All right. Now, we are to the number 8, the resolutions. We have 3 resolutions. 2 of them should go rather quickly, and in fact, they are almost boilerplate. The 2022 Sunshine Resolution, which says that we need to conduct meetings in public, and that the resolution for the Board of Health 2022 regular meeting schedule, we meet on the 3rd or 4th Wednesday of each month, typically at the Citizen Services Center on Garden of the Gods. And we will continue to do so. Right now, there is a gap, a 1-month gap in July. And I hope that people will be able to take July and enjoy that. We can always call additional meetings if we need to. But these 2 resolutions together, I'd like to go ahead and read into the record. And I think we can vote on them together. Any objection? Okay, so the first one is the Sunshine Resolution. I'll read it quickly. Whereas the El Paso County Board of Health is a local public body subject to certain requirements of Section 246402 Colorado Revised Statutes relating to public meetings, and whereas the Board of Health is required by said statute to designate at its first regular meeting of each year a place or places within the boundaries of the local public body for posting of public notices and of its meetings, and whereas House Bill 1087 went into effect on August 2, 2019, and allows local governments to satisfy meeting notice requirements by posting on the local government's website. Now therefore be it resolved by the El Paso County Board of Health, the official place for posting public notices of the El Paso County Board of Health meetings and other public notices for the year 2022 shall be on the El Paso County webpage under upcoming meetings, and the El Paso County Public Health webpage under Board of Health meeting schedule. Number 2, public notices may be also posted on the internet and other locations as determined appropriate by the Board of Health or its secretary. The secretary of the Board of Health shall be the official custodian of the minutes of the Board of Health's public meeting requiring such minutes. The office of the Secretary of the Board of Health is located at the Citizen Services Center. Moved, second, and adopted by the El Paso County Board of Health at its regular meeting held December 15th. In order to avoid confusion, why don't we take a vote by assent on this one individually? So this has been moved. Do we have a second?
Second.
Okay. Let's take a vote on the Sunshine Law. Dr. Vu?
Can I also make a comment?
Oh, please. Please.
I think it is appropriate to vote on a resolution like this without requiring prior public comment, and it is appropriate to have public comment after voting on this resolution.
On the Sunshine Law. Okay.
Correct.
Heard. Other comments? Okay, let's go ahead and vote. Dr. Vu, you're a yay?
Aye.
Aye?
Aye.
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 And chair is aye. Okay, let's go to the second resolution, which is the Board of Health 2022 regular meeting schedule. I'm going to read this resolution of the El Paso County Board of Health, whereas pursuant to Section 251508 Colorado Revised Statutes, the El Paso County Board of Health, hereafter Board of Health, is required to meet in regular session at least every 3 months, as may be established by resolution of the Board of Health. And whereas the Board of Health desires to establish its regular meeting schedule for calendar year 2022, now therefore be it resolved by the El Paso County Board of Health that the El Paso County Board of Health shall conduct regular meetings during the calendar 2022 as follows. Is this on the, not on the screen? Okay. Wednesday, January 26th, Wednesday, February 23rd, Wednesday, March 23rd, Wednesday, April 27th, Wednesday, May 25th, Wednesday, June 22nd, Wednesday, August 24th, Wednesday, September 28th, Wednesday, October 26th, Wednesday, December 14th. Meeting dates and times and locations are subject to change or cancellation due to inclement weather or operational considerations. Special meetings of the Board of Health will be scheduled as necessary. All regular meetings will be held in the John Snow Conference Room at the Citizen Services Center. All Board of Health work sessions, public hearings, regular meetings, and special meetings are open to the public. And so this resolution has been moved. Do we have a second?
Second.
Okay, let's take a vote. Dr. Vu?
Aye.
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 And the chair votes aye. Okay, that's unanimous. So let's get to the topic which has been of great interest in the community, and for which I assume everybody is here to listen to and comment upon, and so we want to do that. Let me just reiterate that we will have 2 periods for public comment. We'll have the one after we read the resolution, we discuss it as a board, and then per the previous arrangements, we're going to ask people here in the order that they signed up to come on down. We'll read about, I don't know, 5 names at a time. So please come down, line up behind the microphone on your side, and then we'll take everybody's comment. As I believe I mentioned before, and as we've done at a previous meeting, I want to limit those, please, to 1 minute, and would ask that you state your name, and if you're affiliated with a particular organization, and if you're an El Paso County resident. I think that's important too. Once we've gotten through everybody who wants to comment here in this room, then we'll go to our online commenters. More discussion if we need it, and then we'll take a vote. That's,
Mr. President?
That's the plan. Yes.
Could I make a motion that we allow the citizens to speak for 3 minutes each?
Okay, let's run that around. We did the 1 minute last time we got together, but okay.
Is there
the
a
motion
second?
is, does Councilmember Donaldson have a second?
Got a question. I've got a question.
Oh, question?
So I've got a, last time we had about 60 or 70 people. I'd like to know how many people we have today as I consider this.
Fair enough. We have that information, yes. How many people wish to speak today?
We have roughly 40 who have signed up either in person or virtually.
40 times 3 is 120, 2 hours. Yeah. Okay. All right.
I think this is pretty important, so I'm okay increasing it, not necessarily 2 or 3, but I would be, I think this vote is so important that we probably should go over a minute.
Okay, so what's the amended motion?
The motion is for 3 minutes.
3 minutes, that's a motion. It's been seconded. Okay. Board members, the motion on the table is to increase the individual public commenters' time limit to no more than 3 minutes. All in favor?
Aye.
Aye. Okay, any opposed? Okay, so be it.
Mr. Chairman.
Yes, please.
Sorry about that. I think if anyone would like to come down and is signed up to speak and is unable to make it this way, please know that there are elevators, and that I'm sure that someone will be happy to direct you and help you get to those. And that puts you down here in this hallway here. So I'm sure that you will be escorted then in at the appropriate time. But please do know that there is an accessible entrance to get down these stairs by using the elevator in the hallway.
What I wanted people to do was to come on down and identify themselves. So people who are mobility, okay, we'll make an arrangement for that. Yeah.
And Mr. President, I would have one other question. Typically, we hear, if there's a presentation about the resolution would be read into the record.
Right.
I would recommend we then hear citizen comments, then bring it to the dais for discussion, then we vote on it.
Okay, does that seem acceptable? Yeah. Members, okay. Okay, we're going to change the order. We're going to read the resolution. I do have a few short comments to make, and then we're going to take it for public comment, bring it back up to the dais where members of the Board of Health will have a chance to discuss it. And again, we voted earlier that any particular subject we should limit to 30 minutes. So I think that is appropriate still. But we'll get to the public comment as soon as possible. Okay, so now our third resolution. Any other comment? Suggestions? modifications?
Just to
Yes.
clarify, the board discussion would be limited to a total of 30 minutes,
Correct.
not the
Oh, gotcha.
totality of the public
No,
comment,
we've
for which we
got
just
at
gave
least
3 minutes.
2.5 hours of comments here. Okay, let's try our third resolution, which is the one which has received a lot of attention, and the motion was previously tabled until this meeting, so we'll need a motion, a second, and a vote to be able to readdress this resolution. So my motion, our chair will make a motion that we take this third resolution, which is in support of voluntary COVID-19 vaccinations, off the table, and we readdress it. Is there a second?
Second.
Okay. Any further comment? Okay, let's take a vote. All in favor?
Say that one more time.
Aye.
Aye? Okay.
Aye.
All right. So this third resolution, which was initially discussed at our last Board of Health meeting on November 10th, there were multiple suggestions for revision. And we should note at that time, we also had more than 2.5 hours of public comment at that meeting on this resolution. We then made a decision as a board to table the motion to approve the resolution and decided to work on some of the wording over the next month. The document we are planning to vote on today is the work of that deliberation. Each of our board members has had 3 different times to go over the resolution, suggest changes, and improve it if they wish. And this is the result of the process. As an aside, I just want to compliment our board for being so generous with their time and talents. These are volunteer positions, and our elected officials are here because they choose to be and want to support public health. And I could not be more pleased or prouder of the selfless service which our board members exemplify. And so I will now read the resolution, and we'll move directly to public comment. Okay? So, effective date, December 15, 2021, resolution in support of voluntary COVID-19 vaccinations. Resolution of the El Paso County Board of Health in support of voluntary COVID-19 vaccinations. Whereas El Paso County Public Health recorded 114,937 COVID-19 cases in El Paso County between March 1st, 2020 and December 6th, 2021. And whereas Public Health has also recorded more than 5,909 hospitalizations and 1,274 deaths in El Paso County due to COVID-19 during the same period. And whereas as of December 6th, 2021, 459,700 vaccine-eligible El Paso County residents, or 68.7%, have been vaccinated with at least 1 dose. And whereas in November 2021, unvaccinated or not fully vaccinated individuals made up approximately 80% of COVID-19 hospitalizations in El Paso County, resulting in strained local hospital capacity and limits on regional resources for surgery and other medical procedures. And whereas data and analysis from sources regularly relied upon by medical professionals in El Paso County and Colorado find the newer variants of COVID-19 to be more transmissible than the original virus. And whereas widespread vaccination is a critical tool to help stop the COVID-19 pandemic, and whereas the Centers for Disease Control and Prevention, CDC, recommends everyone 5 years and older get a COVID-19 vaccination to help protect against COVID-19, and whereas COVID-19 vaccination helps reduce the risk of severe illness, including hospitalization and death, and can also help the people around them, and whereas the U.S. Food and Drug Administration, FDA, reported that authorized COVID-19 vaccines have and continue to undergo the most intensive safety monitoring in the United States history, and whereas the Colorado Department of Public Health and Environment also reports that authorized COVID-19 vaccines were evaluated in thousands of participants in clinical trials, the vaccines met the FDA's rigorous scientific standards for safety, effectiveness, and manufacturing quality needed to support approval or authorization of a vaccine. And whereas clinical trials for authorized COVID-19 vaccine include a more diverse group of subjects than previous trials for other drugs and vaccines, and that El Paso County Public Health offers COVID-19 vaccines and COVID-19 boosters to eligible persons free of charge, reducing barriers such as technology, geography, language, and transportation, and expanding easy access. And whereas colder weather means more time indoors where more people may congregate in close proximity and ventilation may be poor, which may increase the risk of contracting and spreading COVID-19 with a higher risk for unvaccinated or not fully vaccinated individuals. And whereas the El Paso County Board of Health encourages citizens to thoughtfully consider a range of COVID-19 prevention strategies that align with their personal medical situation, including previous infection and religious beliefs. This can include hand washing, social distancing, staying at home when sick, and consulting their personal physician to make informed decisions about receiving the vaccine. Now, therefore, be it resolved by the El Paso County Board of Health that the Board of Health hereby finds the COVID-19 vaccines are a critical prevention strategy to protect the health and well-being of El Paso County communities and reduce the risk of severe illness, hospitalization, and death from COVID-19. And that's where we're at. Do we have the other slide? I think there's one other slide. No? Okay. So let's see. Christian, are you going to be directing this part? Okay. Good, sir.
Good morning. I just want to reiterate that we will go in the order in which the request was made to speak. So those who emailed the Board of Health last week in order to speak, we will make sure that they get in the order that they received. I will ask that if we don't call your name, or if you decide that you want to speak after, if you decide to speak after the opportunity to sign up, we will have an opportunity at the end in order to hear those people as well. So if you don't hear your name, don't worry, we'll get a chance at the end. We will call up at 5 at a time, and as Dr. Turbush said, please just come down to the microphone that is closest to you, and we'll get this on the way.
Okay.
Good to go?
Mr. President,
Point of privilege.
Could I ask one question?
Yes, please.
Christian, I just want to be clear. Citizens who want to speak on this issue, they will be allowed to speak before the issue comes to the dais. Is that right?
Yeah,
Correct.
I believe that's what we're doing now.
Yes, that's what we agreed.
We agreed upon.
That's what we agreed. Okay. And another point of clarification, the resolution was moved but needed a second before we can proceed. Do we have a second?
I second it.
Okay. So it's been moved and seconded. Let's proceed to public comment, please.
Alrighty, and I apologize ahead of time. I'll do my best to pronounce names correctly, but just keep that in mind. So we'll start with the first 5. I have Katie Haddock, Eric Wallace, Martha D'Ambrosia, Ted Maynard, and Lisa Knoll. Once again, Katie Haddock, Eric Wallace, Martha D'Ambrosia, Ted Maynard, and Lisa Knoll. Feel free to come on down to the microphones.
Come on down either side. And let's start with my right, and we'll move to the left, and we'll alternate back and forth. Okay.
Right, great. Thank you for the opportunity.
Doctor, yes, please.
My name is Eric Wallace. I'm an internal medicine physician and citizen in El Paso County.
Mic on, please. We've got Dr. Eric Wallace from University of Colorado School of Medicine. Yeah.
I'm in my 40s, relatively healthy with a wife and 3 kids. As each week goes by, I hear yet another person similar to me who has died from complications of COVID, sadly leaving behind loved ones when our current vaccinations have been proven to markedly decrease the risk of death. I'm also concerned about a friend and colleague of mine who was recently diagnosed with cancer and has to wait indefinitely for her surgery, given that our health systems are currently overwhelmed in caring for patients with COVID complications. The number of preventable deaths when safe and effective vaccines are available is staggering. In the US, 50 million people have been infected with COVID, and 800,000 people have died. 200 million people have been fully vaccinated, or 4 times the number who have been infected with COVID. Of those vaccinated, only 10,000 people have died from any and all potential medical causes, few of which are vaccine-related. How many more people have to die before we clearly state that current COVID vaccines are the most effective way to reduce the risk of severe illness, hospitalization, and most importantly, death from COVID? I prepared for 1 minute, but I have a few other comments, so now that we're at 3. I had a conversation with a physician colleague the other day, someone who is very independent thinking and very conservative, who was very frustrated by the current situation, and made the comment that today it's survival of the fittest. With the data that's out there, if you choose not to get vaccinated and you die from COVID, it's too bad. I disagree with that comment. And the reason I disagree with that is that as individuals, we do not live in a vacuum. Our families and our friends depend on us. We are part of social networks. And when someone dies from a preventable illness prematurely, that leaves devastation behind. We see it every single day. As Dr. Kelly pointed out, we're losing a lot of young people who are unvaccinated, unnecessarily and prematurely. And the other thing I think about is what will our legacy be. If I can make a choice that allows me to help raise my kids and be as alive and as healthy as possible, but I choose to make a decision and I die prematurely, it's something that could have been preventable, what will my kids think? Will my kids be proud of the individual decision I made to stand up for what I believed in as an individual, or will they be upset and angry with me that I died too young or premature illness and wasn't there for their childhood? Thank you.
Mr. President, can I ask a question? Are we able to ask the citizens, especially if they are a professional, if they're a doctor, can we ask them a question?
I think this period of public comment is just that. We're going to have plenty of opportunity to back and forth on the dais to discuss this later. So let's proceed through the public comment, please.
Hi, I'm Dr. Martha D'Ambrosio. I'm a rheumatologist in town. I've been in practice in Colorado Springs since 1993. And that's a perspective that's not public health. I found this discussion among you all and among the professionals here absolutely stunning in terms of good data, because data is all I work with. In rheumatology, I have to explain to people, what do you do? Why would you do this? Why would you put yourself at risk? And commonly it's for longer life, being able to walk, function, that sort of thing. And this has been an interesting journey as I was starting to do volunteering. Because right now I manage the indigent care as a volunteer at PVista. So that's all I do now. I'm retired from my original practice. But I'm still quite involved in the community. But when I was beginning to do vaccination volunteering at one of the local clinics, one of the first people I vaccinated started sobbing. This man was just sobbing. I'm like, was I that bad? Did I give you a shot that hurt that much? And what he said is, in March of 2020, my son died from COVID. I'm here. And he's stuck with me, obviously, ever since. But since the last time this resolution came up for a vote, we've had 100 more deaths from COVID in El Paso County. And it's true, I'm echoing the comment again, how many deaths more will it take to make a recommendation for what has been, in my mind, shown to have fairly clear data in terms of support of vaccination. There's a lot of folks that we all hear from who are frightened and angry about all of this and the decisions that are being made. But we, those frightened and angry folks, are not the ones who are the true public health thought leaders or the scientists. We need to listen to them. But that's my perspective as a physician. But I'm asking you to consider the overwhelming scientific evidence that supports this concept of a vaccine. This vaccine has been present and looked at in testing for 20 years. This kind of mRNA vaccine, this did not just get pulled off the shelf. It's been looked at in Ebola, it's been looked at in rabies, and it is millions, hundreds of millions, and now upwards of billions of folks receiving this vaccine. We know that it's effective. We know that it can have small side effects. It is true there's collegiate athletes who have a 5 times risk increase of myocarditis from getting the vaccine. I'm sorry, from getting the disease. From getting the disease. And that data I can provide for you at any point.
Please
I know
continue.
my time is up, but thank you very much.
Thank you. Okay. Who's next to speak?
Our next group of 5, unless I see any others, Lisa Ramey, Randy Royal, Jim Zietlow, Sydney Rubino, and Shane McCarthy. Again, Lisa Ramey, Randy Royal, Jim Zietlow, Sydney Rubino, and Shane McCarthy. If you want to come on down to the nearest microphone.
Yes, please. Come on down so we can
Oh, you were? I'm sorry.
listen to you. Go ahead. Go ahead. Yes?
Good morning. My name is Lisa Knoll. I'm a registered nurse. I've lived here in El Paso County for 32 years. I'm 69 years old and I retired last year, but for the decade before that, I was one of the Penrose St. Francis Faith Community nurses and worked out at Westside Cares. I gave lots and lots of flu shots. I worked very closely with the health department during the Hep A outbreak a couple of years ago. I just looked over the website after reading the resolution that was tabled. I was also one of the people that signed the letter to you all and to the Gazette, and I represent many of those people who are at work today and can't be here. As I looked at the website, I noticed what's posted about influenza. And the website says that the most effective prevention for influenza is vaccination. And it recommends, without any qualification, that everyone above 6 months be vaccinated against the flu. There's also a document on fact and fiction, listing and dispelling common myths which deter flu vaccination. I call upon you as a board to recommend, not just to say this is a critical thing, but actually to recommend, and I note the language in the current resolution, to recommend vaccination against COVID-19 in alignment with all the current scientific evidence and with our state website message which says getting a safe and effective COVID-19 vaccine is the single best way to prevent the spread of the virus. I also ask that you fulfill your mission to promote and protect the health of our community by undertaking a very well-publicized public information campaign to counter the many, many myths and misinformation about COVID, and to help people understand, as many of the speakers today have, some of what's behind. I understand why people get frightened and things like that, but to really understand where some of that misinformation comes from. Thank you all very much.
Thank you. Next, please. Yes, sir.
My name is Jim Zietlow. I'm a retired Air Force colonel who worked pandemic planning with Dr. Turbush and his representative, Commander Batzel, where we built the 2007 DoD Global Pandemic Influenza Plan. That plan was lauded by the Secretary of Defense. We had lots of vigorous crosstalk and discussions from all different aspects, and again, came up with a solution to protect the U.S. military in operations around the globe should a pandemic occur. Just a few comments on the resolution here. First of all, your stats on the front page. You do not recognize the 13,308 Colorado adverse effects that have happened with the vaccine. 13,308, and that's straight off the VAERS website. That is above the 10,000 deaths that have occurred in the state of Colorado. So you have more adverse effects from the vaccine than you have deaths in Colorado. I just wanted to point that fact out. Also, in your resolution, you mentioned that the unvaccinated are essentially the issue that are causing capacity issues within the hospital. I also would recommend that you discuss the fact that there have been vaccine mandates at these hospitals, and what they do has been pushing staff out that have chosen not to take the vaccine. So these hospitals and medical facilities are understaffed, probably primarily because of that and overworked issues. You mentioned the FDA safety issue. There haven't really been long-term studies on the vaccine. That needs to be considered. Short-term, maybe. Long-term, no, that hasn't happened. In addition, you talk about, on the backside, you talk about protection of people that if you get the vaccine, that that this protects the public. What you omit in your discussion here is you don't look at the full spectrum. What about early treatment protocols? There's no discussion about monoclonal antibodies. There's no discussion about other drugs that might work for people. It's completely missing. What about the country of Gibraltar that has huge breakouts of vaccinated people across the country, and they're 100% vaccinated? Israel. Look at what happened in India with just early treatment protocols and not having to get vaccinated. This entire resolution talks about protection. Again, the last thing I want to say is the vaccine does not prevent a vaccinated person from catching and transmitting the disease. So it's very clear that vaccines do not protect the public. Thank you.
Thank you. Yes, please.
Hello.
Welcome.
Thank you.
Who's this then? Hang on just a second.
There we go.
You got it? Okay. There we go. Thank you.
My name is Shane McCarthy. I'm a family doctor here in town. I grew up in Colorado Springs.
Oh, we need that mic on.
Let me start again. My name is Shane McCarthy. I'm a board-certified family medicine physician. I am a resident of El Paso County as well. I grew up in Colorado Springs, and I've been in practice for more than 20 years. And frankly, I practice evidence-based medicine. For those of you who don't know what that means, it means to practice and give advice to patients based on scientific evidence of things that are proven. And I owe it to my patients to do that. If you were my patient, you would expect nothing less from me. And I would say, as the El Paso County Board of Health, you owe it to the citizens of our community to make recommendations based on evidence and based on science. The scientific evidence is overwhelming. It shows that the current COVID-19 vaccines are extremely safe and effective. There are people that are very loud in their opinions against it, but the people who study this, the people who live it every day, know this is true. The vaccines save lives. They're our best defense against COVID-19 deaths. They're our best defense to prevent new variants and to stop this pandemic. And I urge you, El Paso County Board of Health, to pass the resolution in favor of voluntary COVID-19 vaccines. Thank you.
Okay, thank you. Let me just remind everybody in the room that the respect you give is also the respect you receive. So please, no cheering, clapping, booing, and so on. Let's give everybody a chance to speak. Fire Chief, there you go.
Yes, my name is Randy Royal. I'm the fire chief of the Colorado Springs Fire Department. I have worked in this city and this county for almost 45 years in pre-hospital care. The Colorado Springs Fire Department is the largest pre-hospital care provider here in the county and also the busiest in the whole state for pre-hospital care. So we're on the front lines of seeing the impact of COVID. We see it every single day, and it has been significant for our community. With that, not only to our department, but we've seen the impact to our citizens face-to-face. We've seen the impact to our hospitals. And it was mentioned that because of the shortage of staff, the impact of the hospitals was way before that. And I have a daughter-in-law that's an ICU nurse here, and I can tell you the horror stories that she shared with me about the impact on the hospitals. We see it personally within our staff. The bulk of the people that we're running on nowadays are unvaccinated that are sick in their homes, and many of them are in a critical situation when they finally call 911 and we come to support them. But we're also seeing it within our staff. Between May and deep into this fall, we had a lot of our staff that were sick with COVID that were unvaccinated. There was one or two exceptions, but the bulk of them were unvaccinated. That caused us to mandatorily have to force other firefighters to work, which put more work on them, put more stress on them as well due to that. And thank God we've had a handful that have been critically sick, but we have not lost anybody yet. And as far as myself as the fire chief, that's my biggest worry. I meet with fire chiefs from all around the nation and talk with them, and many of them have lost firefighters. In the previous year, there was 86 deaths to firefighters. This year, we're already up to 144. Again, the bulk, if not every single one of those, were unvaccinated. And the youngest being 21. So the ages that we've seen are being younger as well. And again, we don't want to see that impact within our community and within our fire department.
Archie.
Yes.
What's the interference going on up there? Is something we can fix? Okay, let us know when we can proceed.
Okay.
Go ahead, Fire Chief.
And just one other point I'd like to make is it's very concerning. I think, again, when we have something that is voluntary and something that we can do to help our community and stop that spread, we fully support that. I know there's talk about the comorbidities, but a lot of these firefighters I just shared with you didn't have comorbidities. They were young, healthy firefighters that passed away. We see that in our community as well. But what I would say to that is even with the comorbidities, if you talk about like some of the patients we see with asthma or hypertension that get it, if they didn't have COVID, they could have still lived 30, 40 more years, depending on their age, right? So I struggle with that impact.
Okay.
We support it.
Thank you, sir. Okay, next.
Mr. President,
Please.
since Chief Royal spoke, can we ask Chief Royal a couple questions?
Let's take a vote on this. Are we going to interrupt and question the folks that are speaking, or are we going to allow them to go ahead and continue and say their piece? This part of the meeting I've set aside for public comment, and we agreed to move it up before things were discussed from the dais. So I'm going to make a motion that we continue to listen to the public uninterrupted until they've had a chance to speak, everyone who wants to, and then we'll bring it back up to the dais for discussion. I don't think the time right now is for a Q&A. So that's my motion. Is there a second?
Dr. Turbush, I second that. I think our speakers, whatever side, if we agree or don't agree, don't need to be grilled. I think we need to hear what they have to say and go along with that.
Okay. Moved in second. Let's take a vote. Okay. All in favor?
Aye.
Letting the
Aye.
public speak. Aye?
Aye.
Okay.
Well, if I
Any
could
nays?
just make a statement, I'm obviously in favor of letting the public speak. I'm the one that suggested 3 minutes.
Okay.
If Chief Royal and I are friends, if he comes in uniform, he's obviously speaking in a different capacity than just a person in civilian clothes. So I would have a few questions for him. If your decision is nope, there will be no questioning of anyone who speaks, whether they provide credentials as a physician, appear in uniform and make their position known, that's your decision. I think there's a difference between a person who shows up in civilian clothes, doesn't use a title, and folks who show up in uniform. Thank you.
Okay. My comment is we probably have lots of people in the audience with significant credentials in or out of uniform, and we'll treat everybody equally. So it's moved, seconded, and voted. Please proceed.
We'll go on with our next five. Pablo Bear, Thomas McCarthy, Adeline Bear, Christy Davis, and Kathleen Cleary. Once again, Pablo Bear, Thomas McCarthy, Adeline Bear, Christy Davis, and Kathleen Cleary.
Yes, sir.
Hello, thank you. My name is Paulo Barr. I'm a family medicine physician. I'm a resident of El Paso County. I've been practicing for 21 years. First, since I have a couple of extra minutes, thanks. I think it's important to be skeptical. It's important and healthy to have a healthy.
We got the mic on?
It's a little bit. I think it's important to have a healthy skepticism of data, of the pharmaceutical industry, but it's also important to have an open mind and to not forget the reason for the scientific process. I'm here to support the board's resolution to recommend voluntary COVID-19 vaccinations. In primary care, we work both to treat and to prevent disease. We balance risks and benefits for our interventions. We have vaccines, With vaccines, we have eradicated polio, smallpox. We have significantly reduced the burden of influenza, measles, mumps, varicella. COVID-19 has been a significant burden on our world and on the United States. We've heard lots of data about the number of cases and the number of deaths. The data supporting the safety and the effectiveness of the COVID vaccine are overwhelmingly positive. The medical system, we've had more than 450 million people vaccinated in the US, yet our medical system is overburdened. The burden became the mandates, came before the mandates. So folks in the hospital were having a hard time and being overburdened before vaccine mandates. It's important that we unite and that we follow recommendations that we know work. Those recommendations are wearing a mask, using a vaccine or getting a vaccine, social distancing, and supporting each other. Only through unification can we support ourselves, our community, our country, and our world. I strongly urge you to support this resolution. Thank you.
Thank you. Next speaker, please. Welcome, sir.
Hi, I'm Tom McCarthy. I'm a resident of El Paso County. I'm a retired orthopedic surgeon. I've cared for people in Colorado Springs and El Paso County for the last 40 years. Orthopedics is referred to as major injuries of your arms or legs. People do much better if they participate in their own recovery, meaning wear your casts and do your exercises. Similarly, in COVID-19 pandemic, people can help themselves and their community by getting vaccinated and wearing masks in indoor public settings. I realize that people are tired of these rules and isolation, but these are CDC recommendations, are based on science and facts, not on misinformation from the internet. 80% of hospitalized patients who have COVID in El Paso County are unvaccinated or only partially vaccinated. That's a huge, huge statement to me as a physician. I'm 75 years old. I have 4 adult kids, 6 grandkids, 1 grandparent who's 100 years old. They are all vaccinated, and fortunately, they're all healthy. I fully support the resolution for voluntary COVID-19 vaccinations. I think we as people in this room should be listening to the experts. If you have a heart problem, you go to a cardiologist. If you have a public health problem, you listen to the physicians, Dr. Vu, Dr. Kelly, and Dr. Urbina. They've given wonderful, understandable explanations.
Thank you. Next, please. Welcome. Just check to make sure it's on. Yeah, kind of point it right at your mouth.
Okay.
There you go.
Make sure to speak right into it. Okay. My name is Christy Davis. I'm a resident of El Paso County. I believe that the Health Board should vote down the resolution in support of the vaccine for a few reasons. The resolution complains of the unvaccinated straining local hospitals. However, the charts provided on El Paso County Health's own website show a consistent downward trend in hospitalizations, and so do the charts on the CDPHE website. You showed it earlier and stopped in October, but this graph shows it going down since November through December on their own website. The resolution states data and analysis regularly relied upon by medical professionals in El Paso County and Colorado, but doesn't provide the reader with whom or where this information is coming from. The resolution is in support of the vaccines and claims they are safe and being closely monitored, but you provide the general public with no list of the adverse side effects that come from the vaccines. Even the CDC has documented that the vaccine causes myocarditis and other adverse side effects. You should also be mentioning the risks associated so people can make an informed decision. No vaccine is perfect, and this one has had a shorter time span to undergo testing. The long-term risks are unknown and clearly being ignored in this resolution. The resolution states that this newer variant is more transmissible, but lacks to mention that even though a person is vaccinated, they can still get and spread COVID-19. You are in fact pushing a vaccine that doesn't prevent infection and transmission, it only reduces symptoms. So you are generating a society that thinks it is protected when in fact it is not, and by doing so, you are causing more people to get and spread the virus. Governor Polis just released a statement that he believes the emergency is over and that people who want to get vaccinated and have had the opportunity to do so. That being said, I believe this resolution to be unnecessary and a waste of your time and effort as well as ours. Please vote down this resolution. Thank you.
Thank you. Next.
We'll go to our next five. We have Chaim Goldman, Charity McPike, Tanya Regan, Bill Feith, apologize if I mispronounced that, and Meredith Jones. Once again, Chaim Goldman, Charity McPike, Tanya Regan, Bill Feith, and Meredith Jones.
Welcome.
Thank you. Chaim Goldman.
Yep.
But most people get it wrong.
Yeah, taller one.
No problem. Well, thank you for taking the public comment. The concern that we have, and I'm an El Paso County resident, and was on the first call that you had, the meeting, the special meeting, that was said that you did it specifically, intentionally, because of 5 to 11-year-olds now being able to get the vaccine. I don't know why we needed to get a special meeting. I don't know why we need a resolution. Our governor has just said that COVID-19 emergency is over. I believe everyone knows about COVID-19. They know that the vaccines are available. And why the Board of Health, not the Board of Pharmaceuticals, the Board of Health needs to push a one-sided narrative out to the public at this point is very confusing to us. Very often, people who are cautious about the vaccines, any kind of vaccines, I would like to use air quotes in saying vaccines because we know most of these are not traditional vaccines. They're mRNA technology that hasn't been used widely before. So we're cautious and we're called anti-vaxxers. Well, we're not anti. It's horrible to define someone by what they're not. What we are concerned citizens who want informed consent. We want you as the Board of Health not to put out a one-sided propagandistic resolution that does not consider the other information. And I would ask you to table this again. You said it was not ready for prime time before. I put together with others a task force. We submitted recommendations through Councilman Donaldson. And for all we know, looking at the new resolution, they were ignored, completely ignored. You had 100% of the testimony at the last meeting was against the resolution. You said you were humbled by it, but there doesn't seem to be any humility here. You did not include what we were saying. We want informed consent. We want you to mention data that the vaccines may very well be dangerous, and there's a lot of that out there if you would consider it. Okay, what? Okay, my time's almost up. We would want you to put in there about alternative treatments, off-label medications.
Reconvene. Let's reconvene the board meeting, please. Doctor, no.
This is time.
Okay, let's see. We do have 5. We have 6. Okay. Let us begin. I think, Christian, it's over to you. Yes, please.
Okay.
Complete
May I get a
your
little bit
statement.
of
Thank
time
you.
back?
No,
Okay.
Thank you.
Okay. So to recap, when we were here at the last meeting, we asked for things that were not considered in this resolution. It seems, and we know that this resolution will be used by the media, it will be used by healthcare providers as pro-vaccine propaganda. There's no balance in it. There's no place in it for alternative ideas such as alternative treatments and medications and protocols. And you're not providing informed consent. And so we are asking as a public, since you are a health board, to give us informed consent. You have to realize we're the same group of people that was told 2 weeks to flatten the curve. We don't buy it anymore. And we want information in there, not that you tell people what to do, but that the community is informed properly by its Board of Health. Please table this again today, and let's work together as a community to put out a resolution that all of us can support, that represents all of us, which I believe is your mandate, not to represent only a one narrative, pharmaceutical narrative. Thank you.
Thank you, sir. Okay, next speaker. Who's next? Please. Welcome. Yeah. Tell us your name and am I on mute?
Hi, my name is Denise Kamilic, and I am a tech.
Speak into the microphone.
I am. Hi, my name is Denise Kamilic, and I am a taxpayer here in El Paso County. I was at the last health board resolution. I do appreciate the forewarning this time to be able to prepare and not have it on such an emergency basis. I did appreciate the fact that you allowed the public to comment last time, and you took the time to listen to them, because I know it was quite extensive for hours. What I will say is that I'm not sure that you've taken the comments into consideration, given that this resolution is actually, I didn't even read the last one, but if this is new and improved, I'm absolutely flabbergasted by it. I have to say that 8 of the 13 statements that you have made on here are false. Now, you as a health board, do you really want to vote in and sign your name to false statements? I just have to ask that. Where is your integrity? Where is your concern for the public? So I have to say, are you researching this on both sides? Have you looked at the VAERS website like I asked you to last time? Have you seen the spike in deaths from the people that have taken the vaccine and died? No, apparently you have not. So your statement, 1,247 COVID deaths, false. You know why? Hospitals lie to get money. I know people that have 2 death certificates. One says COVID, one says the real cause. What do you think got submitted? I think it was about money. How about the unvaccinated putting a strain on hospitals? Could it be the mandates that you're asking people to give up their freedoms to put something experimental? This is not a vaccine. This is experimental. And your statements keep going about that. I'll get there. So I want to say that's false as well. The CDC estimates 30% of your medical practitioners have left because of vaccine requirements. How about widespread vaccination will stop the virus or pandemic? Do we have the flu still? Well, it was called COVID these last couple of years, but we have never eradicated the flu. Do you think, and for a doctor to compare the flu vaccine to this vaccine is sheer hypocrisy. How about that there are breakthrough cases in many countries with higher deaths and cases for vaccinated people? That's a fact. Israel is the highest vaccinated rate in the world, and their daily case rate was the highest, 7,500 in August, okay? 7% of their serious cases are triple-vaxxed people. 7%. Triple-vaxxed, okay? Reduces the severity of symptoms and death. Absolutely false. How about the FDA has and continues to undergo most intensive safety monitoring historically? You've got to be kidding me. They haven't even tested this thing for 5 to 10 years. Clinical trials include diverse group. Pregnant women were not included. In fact, I just had a nurse last night tell me that they're seeing so many miscarriages, they don't understand what's happening.
Please
It's
go
all
ahead
from
and
vaccinated
tie
women.
it up.
Thank you so much for your time.
Thank you. Thank you. Good point.
Can you hear me?
Yes. Welcome.
Good morning. My name is Tanya Regan. I graduated from the United States Air Force Academy with an undergraduate in biology and engineering. My father was a doctor, my mother a dietitian. So I well understand modeling in terms of a healthy lifestyle. My father's favorite saying used to be, exercise is a poor man's cure for depression. Yet in this vaccine, in your resolution, I see nowhere in there that there's any recommendations for therapeutics, for exercise, for a healthy lifestyle, for vitamins, vitamin D, vitamin C, ivermectin, or any kind of therapeutics would be helpful. And so I advocate that you come back and look at this resolution and at least add those, because vaccines are not the only answer. Many of you are probably aware of Dr. Robert Malone, who's leading worldwide efforts to stand up against the vaccination. He was the inventor of mRNA, and he has repeatedly advocated for therapeutics being the first line of defense for everybody, and then vaccination for those who are immune compromised. He recently came out with a statement. I'd like to read that and make sure that all of you have a copy. My name is Robert Malone. I am speaking to you as a parent, grandparent, physician, and scientist. I don't usually read from a prepared speech, but this is so important, I wanted to get the facts correct and get every single word in scientific facts correct. I stand by this statement with a career dedicated to vaccine research and development. I am vaccinated. I am generally pro-vaccination. I have devoted my entire career to developing safe and effective ways to prevent and to treat infectious diseases. Before you inject your child, a decision that is irreversible, I wanted you to know scientific facts about genetic research, which is based on the mRNA vaccine technology I created. The first is a viral gene will be injected into your children's cell. These gene forces in your children's body to make spike proteins. These proteins often cause permanent damage in your children's critical organs, including their brain and nervous system, heart and blood vessels, including blood clots, their reproductive system, and this vaccine can trigger fundamental changes to their immune system. The most alarming point about this one is that once these damages occur, they are irreparable. You cannot fix lesions within their brains. You cannot fix heart tissue scarring. You cannot repair genetic reset immune system. And the vaccine can cause reproductive damage that could affect future generations of your family. The second thing you need to know about this fact is that this novel technology has not been adequately tested. We need at least 5 years of testing and research before we can understand risks. Risk and harms from new medicines often become revealed in later years. Ask yourself if you want your child to be a part of the most radical medical experiment in human history. One final point, the reason they're going to vaccinate your child is a lie. Your children represent no danger to their parents or grandchildren. It is actually the opposite. Their immunity after getting COVID is critical to save your family and the entire world.
Thank you.
I'll make sure I extend all this to you.
Thank you.
All right,
Please.
we will call
Okay,
the next group of
five.
five. We have George A., Jeannie Rush, Alex Colon, Kara Field, and Shelley Shepard. Once again, George A., Jeannie Rush, Alex Colon, Kara Field, and Shelley Shepard.
Okay. Welcome. What?
You want to stand right up to the mic?
Oh, sure. Yeah. Yeah.
Can everyone hear me?
Christian, just a moment. Commissioner Bremer has a comment.
That's fine. I want every one of you to know that I want to hear every comment. I will go back and listen to the ones I'm about to miss, but my child's school is closing due to the storm, so I need to go make some phone calls real quick. I'll be right back. Know that the ones that I miss, I will go back and listen to in the next break, and I'll be right back.
Thank you.
Thank you. Okay, go ahead.
All right, you can hear me?
Welcome. Yes.
Well, I am George, an El Paso County resident. I pay taxes, which means I'm your boss, essentially. So coming here today, I'm actually very irritated with this resolution. You falsely claim that it's not about a mandate, but that's a lie, because we know there are businesses waiting right now to mandate this for their employees as soon as you pass it. That's gonna happen. It's a fact. There are a lot of people following the science, but let's follow the Constitution for once. The people are the boss of the government. Now, you don't get paid because it's volunteer work, and I appreciate it, and I thank you so much for that, but you have to listen to the people. We can go into the science of the vaccine. I, quite frankly, don't care. I think it's more important that we look at the constitutionality of this. When the people say no to something, you have to just walk it back and move on. I moved on from COVID when I saw millions of people in the streets looting, and the media just said, well, there is no COVID spread. And then obviously, any rallies with America First Patriots, that's where COVID really exists. So I moved on from COVID. I would encourage everyone here to move on too. And I heard the fire chief speak. I thank him for his service, but if you are in the health industry or in the first responders industry and you're afraid of unvaccinated people, I just think you should resign, because your job is to serve the people. And if you're scared of COVID and people that are unvaccinated, then quite frankly, you're not cut out for the job. So that's just my personal opinion. I mean no disrespect to anyone. We have to stop following these experts and start following the science. If this resolution has nothing to do with mandates, then what's the point of it? Because the vaccines are already voluntary, so what's this about? So we just have to start thinking with common sense. Maybe here's a solution. We have all these hospitals overcrowded. I think a simple solution, since the board cares so much, is for us to just abolish much of the government and spend some money on buying hospital beds. That's how I think we should solve our problems. So if that's how we are approaching this problem, by making it voluntary, that's great, that's amazing, but we don't need a resolution for that. I think you should basically just forget about this, don't table it, just cancel it, shred it up. I don't care what you do with the resolution. It just shouldn't be passed. I pay taxes, and my taxpayer dollars are not going to the government telling me how I can live my life. You say falsely that it's not about a mandate, but we know where it's going. We know where, it's the mask thing. Oh, wear a mask. We recommend it, and then, oh, it's a mandatory thing to enter into this business. I'm tired of COVID. I think the people are over it, and everyone in here understands and sees right through the BS. Thank you.
Thank you. Okay. Next. No, I don't think that's.
It's my letter I sent you.
I understand.
I'm not writing it down. No?
Go ahead.
It's on your email.
Yeah, okay. Okay,
I'm going to read from it, but I won't take up 3 minutes.
okay.
I only have one. I apologize. I'll have to get you one or you share.
Okay, go ahead and let us know your name and if you're with a group, please.
Hello?
Yep.
Am I on? Jeannie Rush. I've been 31 years in this community and business. I appreciate all the effort you all have to go through. I know you're trying to protect us, but this gentleman that just spoke nailed it. You work for us, and we have no input, basically. I want to just read you an excerpt. I sent my email last night, and I sent one weeks ago to, the other letter. In Colorado, we have children who have been given vaccinations at school without the parents' permission, one of whom went home and died, and the family didn't even know why. We have a man in Wheat Ridge who died when they let him out, and they refused the family to use ivermectin, hydroxychloroquine, quercetin, or protocol. Just wouldn't let him have them, and he's dead. They let him out, and he died because they gave him malpractice. And Dr. Peter McCullough testified to our Senate, and he did a video on it, and he says that of the 800,000 people that died because they didn't get early protocols like everyone is discussing as alternatives, 85% would have lived had they been given any of these options. Remdesivir is causing kidney failure, and the ventilators are flooding the lungs, and they shouldn't be the first option, especially for old people. I'm 71, I'm an old grouchy granny, but I'm telling you, we should be giving them nebulizers, budesonide. We should be giving them oxygen and alternatives first, since it's already known. The WHO organization has admitted, and that's not all, 2.7 million adverse reactions to vaccines. And that's not even all the ones, because half of them aren't even reported. The Pfizer, the Moderna, people that are telling you to buy the vaccine are shareholders in all of these. Our government owns part of Moderna, and they've known for years about the potential. Gates patented COVID in 2013. We are being lied to. I agree, you need to take care of people, and medical people need to do no harm. But I think this board needs to, as everyone said, include the reality of alternatives. We're not giving people everything. The amount of class action lawsuits is going to be humongous, and they should be, because we're not looking at what's really going on in the world. And our state, we've got schools pitting against students, against parents. Everybody's afraid. Truth conquers fear. You have not put the truth out, and I don't blame you, you didn't do it on purpose. Please stop this. Thank you.
Thank you. Thank you. Next speaker, please. Welcome.
Hello, can you hear me?
Speak up.
Can you hear
please.
me?
Yes.
Better.
Okay, my name is Karen Field, and I'm
No,
Nope.
you're gonna have
Okay,
to.
my name is Karen Field, and I'm a resident of El Paso County. And I agree with other speakers about your website being lacking of information in terms of if anybody takes a vaccine, since it's emergency use authorization only, it should have its consent, informed consent. And there's very little information about the vaccines on your website, about adverse effects, whether or not it works, the effectiveness, whether or not it can be spread. And I would also like to ask, since Governor Polis has said the emergency is over, and whereas all vaccinations that are available are for emergency use authorization only, is it legal to be using these vaccinations at all? Is it legal? Where's the emergency? Governor Polis said it's over. So be real careful about what you're going to do, because you could be liable also. Thank you.
Okay. Next. Yes, sir. Yes, sir, please.
Can you hear me? Okay.
Yeah,
okay.
Good.
So I'm Alex Cullen. I am a resident of El Paso County, not a native, but got here quickly. Went to Pine Creek High School, then graduated in 2018 from Harvard, cum laude, a degree of biomedical engineering with a minor in government. I am currently with the University of Colorado School of Medicine, forced about a month ago to take a leave of absence, otherwise I would have gotten disenrolled. for not getting the COVID vaccine. So I'm here to tell you that mandates at the university level are here already. The school rejected my positive antibody test as a viable medical exemption. They denied my religious exemption. As a follower of Jesus Christ, pro-life, I will not benefit from a vaccine that uses fetal tissue in the developmental process. Also, the way mRNA bypasses the key introductory immunogenic steps, contrary to God's design, we don't know all those effects. Those are the two main tenets of my religious exemption. There's no real basis for a discrepancy between medical and religious exemptions because the God I serve authored medicine and founded immunity. So in the sense of natural immunity not being offered as a viable exemption, I don't know why that has been so forsaken. T-cell immunity is very long-lasting. You will not get infected with the exact same viral strain once you have lasting T-cell immunity to it. That's why you get infected, though, with a different cold every year because it mutates a little bit, which everybody knows that. Namely, though, ask physicians why remdesivir is being used in the hospital setting to treat COVID patients. It causes renal failure. It can cause residual pulmonary edema. It's expensive, has high adverse reaction rate, has high mortality rate. Why are viable, cheaper treatments like ivermectin, hydroxychloroquine being withheld and being labeled as stupid? I mean, that was in the medical setting in my class. They were ridiculed as viable treatments. Why also are kids 5 to 11 years old or whatever why are we trying to vaccinate them? They're not at risk for this disease. I personally have seen a myocarditis, pericarditis. It was elevated heart rate, lower oxygen saturation within the week after a 39-year-old man got the vaccine. I personally am 25. I fall within that young male age group at which that adverse reaction chance is a little bit higher. So I just, as a medical student, wanted to bring my perspective and my experience with this University of Colorado School of Medicine, who has been mentioned previously today. So thank you for your time.
Thank you. Okay, next. Please.
All right, we'll have our next group. We have Jim Robertson, Mary Beth Thomas, Brian Anen, and Kathleen Stylick. Once again, we've got Jim Robertson, Mary Beth Thomas, Brian Anen, and Kathleen Stylick. I could be pronouncing that pretty wrong.
Yes, please. We look forward to your comments, but the affirmation with the clapping is probably not helpful to our proceedings. So.
You're rude.
Hi, my name is Mary Beth Thomas. I'm a registered nurse, a public health nurse, and a child care health consultant. I'm a resident of El Paso County. I've worked in as a school nurse consultant for about 20 years. I've worked in Whitefield School District, Falcon School District, and Colorado Springs School District 11 for most of that time. I also am a public health instructor for the senior Bethel nursing students. Having most of my experience with the pediatric population in the school settings, just want to talk to you about the ground floor. I do have experience of a 5-year-old who ended up in the hospital with a ventilator, who with no pre-existing conditions. I understand children aren't our high-risk group. That doesn't mean they're not without risk, but let's talk about them as a low-risk group. Children do not live in a bubble. Children are part of their school and the staff at school. They are part of their families, and those include extended families, especially around the holiday season, with people that are at high risk. They include their sports teams that they're on and the coaches and all of those families that those kids then go home to. They're in their neighborhoods and their friends' houses. We all joke in school systems about how teachers are going to catch everything their first few years because children are little germ factories. They don't practice good health hygiene. They're not good coverers of their coughs and sneezes, and they're not good hand washers. And so that's one reason, that well-known thing about kids. Kids do spread, COVID. And because they are less likely to have big impacts from the disease, you're not spreading COVID if you don't have COVID. And so because they are not at home, in bed, miserable, like so many other people who do get COVID, they are staying out in their community and infecting everybody that comes within that, that personal space. And kids also aren't good at social distancing, nor and also not wearing masks. They're not good at that. I work a lot at community centers, and I see the kids are all wearing masks, but half the time they're below their nose or just down around their chin with constant reminders to put them up again. So, I just, speaking from that point of view, being around kids for the bulk of my career, and their families and loved ones, and seeing the impacts that happen. I have 2 children at Hillside Community Center who have gone through much difficulty, which is one reason they are there. Their mother just died from COVID. Her funeral is on Friday. I welcome people to come. So thank you so much for what you're doing. I would implore you to just continue to recommend vaccines and possibly further measures.
Thank you. Thank you. Okay, next, please. Welcome. Is that a little hot? Yeah. There you go.
I appreciate it. Thank you. My name is Charity McPike. I'm a lifetime resident of El Paso County. I'm here as a representative of We the People. Before I begin, first of all, I want to just recognize Councilman Donaldson for being a voice for the people. I feel like you're really the only one up here that we're hearing. And quite honestly, I think there's a lot of people talking about the fact that you should run for mayor. So we'll hope you will consider that. I'm also a mother who's here who has a child who's been vaccine injured because of the lies. He goes to a university that, much like you guys, does not want to present the alternative research about myocarditis. And he's just now coming off of a heart monitor. 3 cardiologists, none of them have reported it to VAERS. So if you're going to rely on your VAERS data and provide that to us, maybe talk with some of the physicians to find out when are they reporting, because they're not required to, as far as we understand. It's as they choose. A couple other things, and I'm also speaking on behalf of a candidate for sheriff who had to leave, Greg Maxwell, when we say that we're asking that elected officials such as you use your power and influence towards something of more purpose than this meaningless resolution. In fact, we ask that you craft a resolution that bans mask and vaccine mandates, vaccine passports, and mandatory COVID testing in support of a free citizen's right to self-determination and a parent's right to decide what's best for their own children, and to restore constitutional freedoms in El Paso County. Secondly, we ask, like many have said here before me, that you would begin to provide the less educated public with some meaningful, data-driven prevention strategies, proven to reduce the risk of severe illness, hospitalization, and death from COVID-19, to include vitamin D, vitamin C, zinc, vitamin K, ivermectin, which is not actually a conspiracy medication. It's been used for decades for various inflammation and airway issues, as you all probably know, and NAC. So anyway, that's it today. We just thank you that you did give us 3 minutes. I'm going to give 49 seconds back, and just hope that you'll reconsider this resolution that is harming our children.
Okay, thank you. Thank you for your comment.
We have our next group. We have Tim O'Connor, Annie McCarthy, John Gadice, Kelly Calabre, and Anna Mitchell. Once again, Tim O'Connor, Annie McCarthy, John Gadice, Kelly Calabrea, and Anna Mitchell.
My name is John Jadis, and
Yes.
I am a resident of El Paso County.
Welcome.
Thank you. I have to ask the question why there aren't dissenting views represented in the beginning. In other words, the people that you've asked to speak here, besides the public, basically had the opinion that, you know, the vaccine is good and that we should all be getting it. But I haven't seen any professional dissenting views asked to come and speak to you guys so you could get both sides of the issues. I know you guys are doctors, but there's a lot of doctors that disagree with the view that the vaccine and the mandates and all that are good. So that's one of the first things I wanted to say. A lot of the things that I wanted to say have already been discussed here, so I'll spare you on them. But what about the false positives on the VCR tests, or the PCR tests? They're coming out, I hear, that they're coming out with tests that distinguishes between the two, the flu and so we're basing a lot of our opinions on the PCR test that is giving false positives. So, you know, I haven't heard anybody talk about that. I mean, all of the stats that you guys are using in your resolution, not all of them, but a lot of them are based on false stats. So I think that you should consider that. And a lot of people have quoted studies, but we don't know what kind of studies they are, whether they were peer-reviewed or not. One example is, and I don't think anyone here can disagree with the fact that the masks really don't work. It still allows the virus to go through them. Things like that. No discussion about it. It's like crickets. And another thing is, why are we calling the jab a vaccine? Because according to the traditional definition, it's not a vaccine. And we know this because the CDC changed the definition of a vaccine this year, a few months ago, along with Webster's Dictionary. They changed the definition of a vaccine as well. So those kind of things have to be taken into consideration. We're just using it as a vaccine. I think most of the people here are not against vaccines. It's just this new technology. Okay. And I heard someone say 20 years. Whoops.
Yes, sir.
Oh.
Okay, thank you. Next, welcome. Welcome.
Thank you. My name is Tim O'Connor. I've been a resident of El Paso County since 2009. Thank you for the opportunity to speak. Can you hear me now? Okay. So this is kind of ad hoc for me. I didn't prepare anything, didn't think I was going to be here today. But I keep hearing people say, well, if we follow the science, people have to interpret that science. And sadly, this is a very politically charged situation. And we come with our presuppositions. And I would ask you to just put aside your beliefs and really look at dissenting comments from your own belief system. Because when you do, when you start following some of the different studies and the random clinical trials, you start looking at countries like Israel, one of the most vax countries in the world, and the problems they're having, you can see that there's something wrong here. And I would just ask that, first and foremost, I don't know if you believe in Jesus Christ, I do. So I'm going to pray for wisdom for you to make a good decision. I think you've already made it, sadly, and I don't think that's the way it should be. In fact, the councilman had even suggested that we stop the order of how we were going to do things based on public comment. I think you really should start listening to public comment because it doesn't take a lot of effort to dig up dissenting information, both sides. Clearly, there's something going on here that needs to really be better looked at and investigated. I would ask that you would table this until you had more time to really look at dissenting opinions. But in Jesus Christ's name, I pray for this board, that you would have wisdom. God tells us in His Word, when we ask for wisdom, He'll give it. I would pray that you would have the wisdom that God would provide for you to make a good decision for all the community, not just your politically affiliated portion of the community. There's a lot of big money behind this, and I think it's corrupting people's ability to make good decisions because the media, both predominantly progressive and even conservative, isn't bringing up the information that you need to make a good information or good decision. So I pray for God's wisdom on this board, and I would have you table this until you can really make a good decision. Thank you very much for your time, and God bless you.
Thank you. Let's see. Chris, let me ask, how many more groups of 5 do we have?
We have one more after this.
Okay, well then let's press ahead. Please. Oh yes, no, I know. We'll get to the online.
Make sure you speak.
Going to finish up here first.
Okay, I'm Anna Mitchell. I'm a resident of El Paso County since
You speak into it a little bit more.
17 years now, at least. Okay, I urge you as well to table this resolution. We do not need a resolution. We need to follow the Constitution, which does not allow for mandates. And this resolution doesn't expressly say mandate, but it is leading to one. All the experts who have spoken today in support of the vaccinations, well, supposed vaccinations or vaccines, do not use facts and true science. The VAERS system states the vaccines are not safe. So it's vaccine adverse event reports system. Here I have a copy of it, a recent one from a week ago, I believe, and the total deaths is 19,532. Hospitalizations, 99,942. Urgent care visits, 102,600. Doctor office visits from the vaccines, these are, not COVID, 145,286 doctor visits. Anaphylaxis, 8,300. Bell's palsy, 11,600. Miscarriages, 3,100. Heart attacks, 9,700. I'm getting emotional because this is sobering facts. And like they said, it has not all been reported by all doctors. Myocarditis, 15,000. Permanently disabled folks from the vaccine, 31,000. And I could go on, but I won't. Some have said vaccines have eradicated diseases. However, these vaccines were thoroughly tested for years and years, polio, et cetera. These new RNA vaccines have not been tested for years and years. And the ones that were tested previously and had even 50 adverse effects were tabled, were stopped. And we see all this data. Many thousands and hundreds of thousands of people have been adversely affected, and we still haven't tabled a vaccination, quote, vaccination. So if the Board of Health supports this resolution, you all contribute to this strain on our hospitals, like we've talked about, and all the harm that the vaccines will cause and have caused our citizens of El Paso County. The strain on the hospital system is not from COVID. It is from the mandates that the hospital employees get the vaccination. That's what the strain is. So let's get the truth here, not lies. The hospital deaths reported from COVID were from the hospitals not having an effective protocol to treat COVID. They did nothing for me when I went to the hospital because my blood oxygen level was low. And they told me hydroxychloroquine would kill me. However, I waited 2 weeks and got ivermectin, and I'm here to say that I survived COVID.
Okay, thank you. Okay, next person.
Make sure to speak right into the mic.
I will. I just don't want to touch it.
Uh-oh.
No, I'm kidding.
You're good?
I'm happy to touch it. Okay, now, wait, I don't want my ticker to start yet because I'm thank you. I'm happy that we're able to speak our opinion, but I'm just curious why we did not start this meeting with the Pledge of Allegiance. Is that something we normally don't do? I don't know.
I can answer that. We
Okay.
in the Board of Health have not typically started our meetings with the Pledge of Allegiance or an invocation, but I would certainly be open to that in future meetings.
I'd love that, because we all are united.
Yeah.
We the people.
The county commissioners do that regularly.
You can make that Annie's rule.
I've been,
okay?
right.
Annie's rule.
Okay, go ahead.
All right, start my ticker. I had on here good morning. Well, it's good afternoon. My name's Annie, and I'm a member of We the People. I am a child of God. I am a sovereign citizen of the United States of America and El Paso County. I'm a small business owner, and I'm missing a day of work, but I'm happy to do it because we the people. I'm a wife, I'm a mother. I'm a truth seeker, and I am a fact finder. I'm also a taxpayer, guys. This is what I am not. I am not delusional. I am not manipulated by propaganda to fit dishonest agendas. I'm not a science experiment unless I choose to be one. This is what I believe. I believe I have the right to make decisions regarding my body, and I also believe in common sense. Oh, 2 weeks. Oh, wait till we get the vaccine, then you could take the mask off. Oh, wait, now you're going to get another vaccine, but you're going to start wearing the mask. You get another vaccine. Now we're going to booster you, and then and we're going to give you another booster in 2 more weeks. It's not science. It's insanity. If you want science, we can look up the VAERS data, which I won't go through. We know where to find it. And yesterday, Dr. Peter McCullough said that 85% of deaths could have been prevented if they would have been treated early. I have to ask then, is that a coincidence that the FDA yesterday is working with the United States Post Office in detaining shipments of ivermectin? Why? Therapeutics work? What's going on in our hospitals? When you can get ivermectin or hydrochloroquine for 8 cents a tablet, but hospitals are being paid maybe $1,000 when they use remdesivir. Maybe the data that was presented today and people are dying of acute renal disease because they're getting vented and they're given remdesivir, but yet the hospital might get a kickback. I don't know. I don't know if we'll ever know that. Yet the CDC last year told us that you have a 99.9% or 99.9x% chance of this being curable. And we're still going through the same things. We're over it. We're done. Who knows who's dying? Who knows if they're vaccinated or they're not vaccinated? Is anybody going to tell us? That the gentleman, the Dr. Kelly, when he got up today, he defined vaccinated for me. Is it 2 weeks after a vaccination, or is it within the 7 days? Let's have more concise data. So, again, I'm getting shaky. Gotta hurry up. Okay. So, with all due respect to the El Paso Board of Health, I'm going to choose my body, my choice. And I'm just asking you to stay in your lane, the lane being the Constitution of the United States of America. I want to have grandchildren someday.
Here you go.
Okay.
Thank you.
Thanks. Have a good one.
Thank you. Christian, how are we doing? Are we ready for the online folks yet, or we got?
We have one more group of those who have signed up, then we'll do the open call for anyone left in the room, and then we'll go to those online, if I heard your question correctly.
Okay.
The next group we have in person who has signed up, Kim Drozdock, I apologize, Laura Vandermost, Pam Helter, Mary Louise Fiedler, and Andrea Nagy. Again, Kim Drozdock, Laura Vandermost, Pam Helter, Mary Louise Fiedler, and Andrea Nagy.
Hi, my name's Lori. As a grandmother of 6 with one on the way, I am somewhat appalled by your comment and your comment, Dr. Vu, that we must vaccinate our children to keep grandparents safe. Children have a greater risk of getting myocarditis from the shot, like my 19-year-old nephew, who has been rushed to the ER 5 different times
than from dying from the virus. I have never stopped visiting my grandchildren this entire pandemic and would never be so selfish to sacrifice my grandkids to an experiment to keep me safe. Since the vaccine makers can't be held liable for my nephew's medical bills and shortened life expectancy, are you all willing to be held liable if even one child is harmed because of the one-size-fits-all COVID vaccine that you want to promote? You must include all risk and deaths in this resolution so citizens can have the knowledge needed to make an informed consent. Will you be willing to include alternative remedies in this resolution? I easily recovered, and so did my high-risk husband and 76-year-old roommate with our prescribed NIH-approved ivermectin and HCQ. One reason people don't want to go to the hospital is because the Fauci protocol with remdesivir and ventilator is responsible for mass deaths, including my own 39-year-old niece who wasn't that bad when she went to the hospital, but once they put her on remdesivir and the ventilator, she almost died. So this resolution is not necessary, and you're not following the science, because if you were to look at the VAERS database, over 900,000 people have been recorded with injuries, and my own nephew's not one of them. So please, start doing your job. This is not about public health, and we are not going to put up with any vaccine mandate, period.
Okay. Next.
My name is Kimberly Drozdick. I am an El Paso County resident, taxpayer, and I also do hold a master's in counseling that I got out of Chicago. And I did treat children that had to deal with many different issues when they are told how to live their life and they're told that they do not have freedom to choose. I did not think I was going to speak today, but after hearing and being here, taking time off from my job, and wanting to stand with these beautiful people here who are fighting for freedom, that's what I want to say most and foremost, is most importantly, I fight for freedom over fear. I have a first grader in this world that I will protect till the death. She's my one and my only. I want grandchildren. So I'm going to get back into what I started to write while I was sitting here listening. There is very little discussion about natural immunity, only mandates to inject people with an EUA, only comorbidity was not. It was approved, but they don't make it. So please don't lie to us and tell us you're giving us something that's been FDA approved. And the simple fact that the jab is not working. Fully jabbed people are still spreading and getting sick and dying. I also want to bring up VAERS like anybody else. This is simply ignored, and I want to know why. This is real, and I know people who have been injured and died after getting the shot, and I'm only 44. Or died after getting the shot, and that is something that no medical group wants to touch, they don't want to talk about, and somebody else said it today, you only got to hear something about the vaccine, but not about adverse reactions. So that is the truth. We have to have transparency across the board. We have to listen to both sides. I'm not anti-vax, I'm vaccine-free. I'm free from tyranny. I'm free from somebody telling me what to put in my body and my daughter's body because I choose for her. She doesn't have a voice. I am her voice. She's 7. She's healthy. I choose to eat right. I choose to exercise. I have her do the same. Her favorite food is Brussels sprouts. You know, those are decisions that we as parents choose for our children. And I do not respect people who want to do a one-size-fits-all, that tell me that me and my daughter and my husband and my 71-year-old mother have to decide what is told in my body. I live in America, under the United States of America, the Constitution that gives me the right to choose for my body. And so this is politicized. I went off script, but I needed to, because this is something from the heart. This is not something that I could ever do if it wasn't for last year and God giving me the freedom and the truth to come through my heart to stand here today in front of all of you and tell you that God is the owner of our immunity. He created each one of us individually. He privileged us with individuality and our immunity. So I thank you for this. I will also pray over for wisdom and joy, and I ask that you please take this resolution off. It does nothing for for both sides. Follow the science and follow truth.
Okay. Okay. Christian, where are we at? We've had people waiting online for a while.
We're nearing the end of the list, and
Okay.
then anybody else who's left in person, and then we can go to the online.
Okay, because one of the previous speakers said they were getting shaky, so I think that's a pretty good indication we might want to take a break after the folks who are in the room have had a chance to speak. Then let's take a break. I'll announce that when we get there. So you let me know when we're ready.
Hi, my name is Mary Louise Fiddler. I am from El Paso County. I have 3 questions. I want to know how many of the patients that the coroner talked about today who died were treated with remdesivir while in the hospital, thereby potentially causing their death. Number 2, I want to know how many of the patients who died were denied ivermectin while in the hospital. Number 3, I want to know how many of the COVID patients who died were denied a prescription of ivermectin prior to even needing hospitalization or ever coming close to death. I hear people expressing grief and compassion for those who've been lost due to COVID, and I absolutely 100% agree. But let's start at the beginning, where the protocols that heal were being denied to people who needed them and would benefit from them. I also consider how much money is being made by pharmaceutical companies, hospitals, and administrators in regards to hospital care and vaccines. And to say that there are no injuries from these vaccines is an outright lie. It's not true. There are injuries. These are valid questions and concerns to be brought up when the board is considering passing this resolution that will not only influence, but will pressure individuals, businesses, and public service entities, including our schools, to get vaccines and to promote vaccines. We've all heard it. We all know the vaccines are available. If you want a vaccine, get it. If you don't, don't. Do not use the power and the influence from this board to pressure the public when there are risks and alternatives that are clearly not included in this resolution. There is simply no need for the resolution, and I urge the board to end consideration of this resolution.
Okay.
Almost done. This is my son, Jacob. Say hi, Jacob. I homeschool him. He's been in civics class for about 3 hours now. He's 11, and I will never, ever give him this vaccine. And nothing you could say would influence me to do that, but this resolution will influence others. And I would say, going back to the injuries that have occurred, when you put your name onto this resolution, I'm not even going to say the word liable, because, which is valid too, but you have to know that when you sign your name to this resolution, you are validating any person who is influenced by you and has an injury to their child. It is in your hand as you sign this resolution. It's in your hand.
Okay.
And on your conscience. Thank you.
Thank you. Christian?
Hi, I am Pam Heiler. Can you hear me? Oh, thank you. Yes, there we go. I'm Pam Heiler. I'm a resident, mom, military wife. I was not planning on coming today. I was listening at home and decided that I really wanted to comment. First, I just want to say thank you for your service, of course. And I do want to recognize that I'm guessing public comment hasn't been huge at health department meetings. And the reason it is because the government has been overreaching into our lives. I know my husband's job's on the line right now. I can tell you I have 2 kids that were vaccine injured from childhood vaccines. And when something like that happens to you and you have your doctors look at you and be like, I don't know, and they don't acknowledge it, It makes you question, which is why I question everything medically now. Anyhow, I just want to bring up that as the VAERS has been mentioned, I know my kids were not included in that for that particular thing I'm referring to. I know my boys are super into athletics. There are professional athletes that have been dying in games, on the field, in their sport, or athletes who can no longer participate. The people who are getting the shot are still getting sick. I know at my daughter's school, the teachers who have the shot have been out with COVID. My son just told me last night one of his best friends, he got the shot, got very sick from the shot, and has now been diagnosed with COVID-2.
Hold on.
I don't think it's working. Oh, here we go. So I'll just say that over. My son's friend who got the shot was very sick from the shot, and then he's been diagnosed with COVID twice since, which is weird. I'm thinking that even though people have the shot, they can still be contagious if they're sick. I do know lots of people. I also have a friend who went into anaphylaxis after she got the shot, was driving her car, her arms and legs started flailing, got taken to the hospital, and when they finally were able to help her, the doctor said, "You were here for a cold, get the second shot." Didn't even acknowledge she went into anaphylaxis from the shot, but it doesn't even make sense. So on the hospital record, it said reason for coming was a cold. She didn't have a cold, she came because she had anaphylaxis. I would ask that there would be collaboration with doctors who have been censored. I'm not sure why doctors are being censored. I don't know why protocols are being censored. I don't know why treatments are being censored. So to me, that means we should ask some questions. And there was someone else who commented and said, maybe look into some other opinions, because science, the way I understand it, is, we don't all know what's right. Our bodies are very individualistic. We all respond differently. We all have different risk factors, and you collaborate and you work on what's best, and the one size fits all doesn't work, but we need to listen to each other, and in the past, that's what happened in science, but I don't think that's happening right now. Thank you so much for listening, and I hope that made sense. Like I said, I wasn't planning on commenting.
Okay, thank you. Thank you. Okay. Here we go.
Hi, my name is Andrea Nagy. I just want first.
If you can speak right into it.
Oh, right into it?
Yep.
Okay. Okay, my name is Andrea Nagy. I'm a resident of El Paso County. I would like to respectfully ask the board to stop this resolution. I haven't seen any research or honest discussion about early treatments and early treatment protocols. I believe your resolution is one-sided. And also, I would like to share my personal experience with vaccinated friends and families. I know personally 6 friends and family members that got the shot and spread COVID. I'll give you an example. It was my sister-in-law. She was really tired. She didn't know she had COVID, and she went to a concert. So just taking into account that I don't think you can longer recommend the vaccine for a protection of the community. I'm so sorry. The vaccine is not protection of the community. The people that are vaccinated are spreading COVID more than people that are not unvaccinated. So that's one of my biggest issues. As a family too, we experienced an ultimatum email from my husband's job that they say you get the job or you get you are fired. Very, very cold email, and with no option for unemployment. He has worked for 30 years, not stopping. So this is, they're attacking the people, they're attacking our freedom. I ask you to give accurate information regarding early treatment and do an honest research. Do an honest research in COVID vaccines risk and the transmission by the vaccinated people. Thank you very much.
Okay. Christian, have we been able to hear from everybody who signed up?
Those are all the ones who have signed up for in-person.
Okay.
We do have 5 who signed up that are virtual at the moment. We can also open it up for anyone who didn't sign up if you'd like to at this moment.
Why don't we take a recess at this point? We'll recess 30, 45 minutes? What? I'm sorry, what? Oh.
And then give a definite time.
Okay. Who left in the room that didn't sign up previously would like to make a public comment? We got two. Okay, let's do it. Please, come on down. Tell us who you are and if you're with an organization. And then we'll take a break for 30 minutes after that. Okay, go ahead, please.
Stephen Spencer. I didn't come planned to speak about anything, but first off, I just want to say the election was stolen. Trump won the election. We are being fed lies and misinformation constantly from the news media, radio, television, and they're promoting fear at every opportunity they possibly can to scare the people into succumbing to a virus. I've got Gates and Fauci were roommates in college. I've got Gates on a video stating if we can create a vaccine that would reduce the population by 10 to 15%, we've done a good job. Think about that. Fauci sent money over to China to experiment on this and create a variant disease that he could release on humanity. This whole thing is a worldwide plot to control and take over the world into a one government system. Everybody's on board. Every nation's succumbing to this. Propaganda, this is what Hitler did to control the masses in Germany and use fear. 99.6% of the people get over this thing. And yet, they promote it every opportunity. I can't watch television. I can't listen to the news. Anyway, we don't need this. We do not need this. You've heard every testimony from the people, and there's other ways to combat this than controlling the masses with a jab. They don't want it. It's taking away our freedom, and they're pressuring us to succumb. It's not right. It's communism. Do you guys not see this? So do away with this thing. Kick it to the curb. And thank you for your time.
Thank you, sir. Christian, let's take our last commenter, and then we'll go to break. We'll take 30 minutes, okay? Please. Welcome.
Hi, thank you for taking my comment. My name's Jennifer Bertram, and I have a pretty serious matter to talk to you guys about. Back in June, while my dad was in a nursing home, they coerced him to get this injection. He had been saying no for 4 months. They re-educated him weekly. They finally convinced him that if he goes ahead and gets this injection, which he should never, ever, ever have had, that my mom and myself can go see my father in his own room on the days that he was not feeling well enough to get out of bed. So he got the injection. Then we found out about it because we were lied to. They didn't tell my mother. My mom was his medical power of attorney. My dad couldn't sign anything. They signed his consent forms with his signature. So when we found out about it, I actually started videotaping my dad's response because I wanted to know what happened. And he said he felt he was forced. And why are they trying to force people to take something that is supposed to be saving lives? Why would you need to force them? My daddy died October 7th of, guess what? A heart attack, sudden death. The coroner would not actually grant us a permission to have an autopsy done so we could actually prove it to you, because these people who are dying cannot get autopsies. It costs $3,000 or $4,000 out of your own money to have an autopsy done to prove to you guys that this injection is actually killing people. That's why the coroner said, well, I have nothing, written down for any deaths from the actual injection. But my daddy died from this. He was told that we could see him in person in his own room. And then my mom was told, no, she had to be injected as well. What kind of crap is that? How is that being anything good and decent to our humanity? Nobody knows what's going on in our nursing homes. They have been dying of loneliness. They've been told they can't see their family because we're not injected with an experimental drug. Most of them have already been exposed to COVID over and over and over again in the nursing homes. They either have full natural immunity at their older ages with all of their other issues. Many of them have survived it. But yet, my family could not see my own father in his last days, which were not supposed to be his last days. His last days came way too soon because of this injection that you guys are going to say you support. How can you support something that's literally hurting people? That's not helping our community. And our children do not need this. It's disgusting that any one of you would actually support an experimental injection for children. Give it some time. Thank you.
Okay, thank you. So, Christian, what we'll do at this point, we're going to recess for 30 minutes, come back 10 till, and then we'll take the online commenters, okay? Thank you.
We have 5 people online, so we can tell them about 11,
Okay, we'll come back in
so?
30 minutes.
Okay.
Great. Well, we promised to reconvene at 10 till, and we have unfinished business. And Jared, we're going to start with online public comment at this point.
Yep, thank you, Dr. Turbush.
Okay.
So we've got 4 people, I believe, online.
Okay.
For those that are online that can hear us, for those that are not on the phone, please raise your hand, and we will introduce you in the order that you raise your hand. And we've got 2 people on the phone. Once we get through the people on Teams, we'll go through those 2 phone calls and get them going.
Okay,
So,
good. Go ahead. Please. Please. Welcome.
Okay, thank you. I want to thank you for allowing me to speak today. I have literally re-signed on 24 times to get through to you due to the wind problems. I want to say I am a resident of Paso County for 25 years, and I did speak at your last meeting regarding this issue. I am very curious about the coroner's testimony, or no, what he spoke about, because I have here a photo, I hope you can see, of my nephew and my sister. My nephew died this year at 43 years old after having had 1 Pfizer shot. His autopsy says, which I have right here, his autopsy says that it was pulmonary thromboembolism was the main cause. And yet on the opinion, it also says, it's also my opinion that probable COVID-19 infection. Now that's interesting because we donated his body to Care Science for research, and they would not touch anyone who had anything COVID related. I have a copy. I have the phone call she made to us from Science Care saying, we have been cleared by the coroner's office that this had nothing to do with COVID, and we have accepted his body. So you're telling me that the coroner is giving good information if they're basing their numbers on an autopsy report that is false. So that's really interesting. The other thing that I want to quickly say is this is a right to try state. Colorado was the first right to try state. which means we can try whatever medications we want, especially when you're in a dying condition. My sister, as I showed you a minute ago, his mom died 27 days after my nephew. He dies suddenly after a COVID shot. She dies because she was admitted 3 times to a hospital and was never given any of the treatments, not even her prescriptions during that time, and was put on a ventilator for 11 days, 6 of which they refused to let me in to see here as her directive on her POA. So you tell me we're supposed to be believing what the scientists and doctors are telling us? You have got to be kidding. This is a right to try state. Also, you have NIH, Patient Bill of Rights, that says we can consent or dissent from any treatment of any experimental thing going on. We are not required to take it. This is experimental because you can't show me a study that's even a year old or 2 years old or 10 years old on what this vaccine is going to do.
Yes, ma'am.
So explain to me why we're having to have a resolution to have something voluntary when it's voluntary. I am totally confused on what you're trying to accomplish here. But I do appreciate being able to speak. Thank you very much.
Well, thank you for your patience, and thank you for your comments. Okay, next.
Meredith Jones, please unmute yourself.
No, not yet.
Okay, I'll move on. Oh, here's Meredith. Unmute yourself, please.
Okay. Hi, my name is Meredith. I am a resident of El Paso County and am not here representing any specific groups today. First, I would like to thank those of you on the board and all the staff who have been working tirelessly to keep our community safe. I work in healthcare, and I've spent the last 2 years working with experts such as infectious disease physicians and a physician on the CDC, APIP, Immunization Advisory Committee. And I trust the experts. These are the professionals who have dedicated their lives to understanding and mitigating disease, which is why I'm providing remarks today in support of a voluntary resolution for vaccines. This is a voluntary resolution, not mandated, but encouraging people to get a vaccine. A vaccine that science has proven to be safe, effective, and to save lives. And as stated earlier by many of our local experts, it's the best tool we have to keep people healthy, reduce the severity of illness, control hospitalizations, and reduce deaths. And data shows that the risk of developing myocarditis after a COVID-19 infection is much higher than after the vaccine. The vaccine can help us get back to some kind of normal. And in closing, please focus on the Board of Health's mission. And the public health is population-based health and support this resolution. Thank you.
Thank you. And again, thanks for your patience. I know you had to wait a long time. Okay, next.
Katie Haddock, please unmute yourself.
Good afternoon. Can you hear me?
Go ahead.
My name is Katie Haddock. I am a registered nurse. I am a volunteer with El Paso County Medical Reserve Corps, but I am representing just myself this afternoon. I'm a citizen of of El Paso County. I began giving COVID vaccinations last January. At that time, only the elderly were approved to receive vaccination, and they were grateful. Many cried. At that time, many said, "You have given me back my life and my family." Finally, after all the illness and death and fear and economic chaos, we had a weapon to use against the pandemic. I felt very honored to be on the leading edge of that fight. According to many research studies and statistical facts, there is no question that vaccination is beneficial, not only for the individual, but for the health of our communities. Science has showed us the effectiveness of the COVID vaccine to prevent severe disease, hospitalization, and death. It has also shown that mutations develop in unvaccinated individuals. The virus can learn ways to get around our immunity. Unvaccinated people put everyone at risk. And right now in the United States, among our senior population, those individuals 65 and older, 1 in every 100 people has died of COVID. Since we know vaccination can reduce the severity of disease and prevent hospitalization, a vaccinated population can help prevent many of the problems we've experienced as a result of this pandemic. Nurses are leaving the profession because they're overworked and overstressed. Patients with diseases that can be treated are suffering and sometimes dying because there's no room in a hospital for them. Elective surgeries are postponed indefinitely, again, because our hospitals have no room. El Paso County Public Health strongly recommends wearing a mask in public indoor settings, regardless of vaccination status, in alignment with Centers for Disease Control and Prevention recommendations. We currently fail to strongly recommend vaccines. While masks are a useful layer of protection, vaccines remain the most effective way to control this pandemic. We need our public health leaders to take a strong stand in favor of facts and science in recommending vaccination. And as a citizen of El Paso County, I strongly recommend that our public health department pass this resolution in support of voluntary vaccination. Thank you.
And thank you for your patience. I know you had to wait a long time. Okay, next, Jared.
Okay, I have a person with exchange 321 on the phone. You can unmute yourself by star
Okay.
6.
Yes. Star 6. And then please let us know your name. Yeah.
Are you able to hear me?
Yes, we hear you.
Hi, my name is Dr. Sidney Rubino. I'm a retired physician. I am a resident of El Paso County since 1982, and I have had some public health experience. I served as the clinical services program physician for the El Paso County Health Department several years ago back when the clinic was on Union Boulevard. I'm speaking in favor of this resolution. The headline in the paper this morning, front page headline, was describing 3,000 deaths in the state of Colorado due to COVID. We also have had, 1,300 deaths in El Paso County. I feel that the board cannot remain silent with this obviously tragic health crisis that we have. The resolution is well documented. It's not a mandate. It's simply advice. The public, I think, can expect that the Board of Health will give them sound medical advice. That is the function of the Board of Health, and I would strongly urge that the board adopt this resolution. Thank you.
Thanks for your patience. Paula?
Person at exchange 930. You can speak now.
Go ahead.
Hello? Okay, I'll move on.
Wait, star 6 to unmute. Go ahead.
You're unmuted. Go ahead. Okay, we'll move on to the next person, Andrea.
Okay.
Please unmute yourself. Andrea? Okay, well, with no response, we're done.
Give him just another 30 seconds or so, Paula, and see if you can raise him again, okay? Please.
Okay.
Hello?
Andrea?
Hello?
Hello?
Hi, for some reason I have 2 audio inputs coming in from the meeting. Hello? Hello?
Hello, we hear you. Yes, please, go ahead.
Okay. Hi. My name is Andrea Mercier, and I wasn't aware of the way to publicly comment on here. But I just wanted to talk about the post-marketing data of Pfizer. It's very concerning. Hello? Hello?
Go ahead with
Go
your
ahead.
comment. Yeah.
Can anybody hear me?
Yes, we can hear you.
Okay, so the post-marketing data of Pfizer is very concerning. I would encourage you guys to look that up and read about it. I would also like to discuss the decreased antibody response to the spike protein after repeated vaccination. That data available is on medrxiv.org. And the repeated studies that are showing that vaccine-induced myocarditis is worse than naturally occurring SARS-CoV-2. So it is very important, I believe, that people should have access to multiple modalities of treatment during this pandemic, and to reduce the constant message that's being sent out to the public. Thank you for your time.
Thank you very much, and thanks for your patience. Next, Paula? That's it? Okay. Well, thank you, all the commenters. And again, thank you for being patient with us. Now, we had agreed early in the meeting that we would limit ourselves to 3 minutes per Board of Health member and no more than 30 minutes on any particular subject. And we had also read the motion, the resolution. We read the resolution. There was a motion to approve and a second. So that brings us right up to the brink of a vote, except we need to go around the horn one more time and get comments from each of our Board of Health members. And let me apologize for Commissioner Bremer. She had to go get her kid. The kids are being evacuated from the school, is my understanding. So mother's duty on that one. And thank you, Commissioner Bremer, for continuing with us so long in these proceedings. So here's what I'd like to do. I have a prepared statement, much less than 3 minutes.
Dr. Turbush?
Yes, please.
May I ask for one question of public health before we begin?
Please.
Because it got brought up so much, and I received a lot of emails. Can I get just a 2-minute summary from our own staff on VAERS data and their perception of that? It was brought up a lot today, and including on emails, and I'd just like to hear something.
Fadi is here. Let's imagine.
That's okay, and I don't need it very long.
Oh, okay, Dr. Urbino. Okay,
I would just appreciate a statement or something.
And then we'll get with the Board of Health member comments and on to the vote. But can you help us with the VAERS question, sir?
Give me the 2 minutes, please.
You got it. 2 minutes.
Thank you very much for the question. Is this on?
Oh, no, louder.
Thank you very much for the question.
Can you hear? Can you hear Dr. Urbino up there? Okay, yes. Speak up, please.
The Vaccine Adverse Events Reporting System is one part of the vaccine safety regulations that are required for all vaccines. There's VacSafe. There's a couple other programs out there that actually try to follow vaccines and all medications. So this is an example of that form that's listed to all health providers. Anybody can report adverse events associated with any medication or vaccine. It's very common. So what you'll see in the database are thousands of reports that come after a vaccine. It could be anything from knee pain, to headaches, to nausea, vomiting. It could be anything related that people believe is related. A parent can report, a doctor or a healthcare provider can report, an individual can report. So we get a lot of information in this. What ends up happening with the information is that both the FDA and CDC look for trends in the data. So when we discovered that very severe reaction, central vein thrombosis associated with thrombocytopenia related to the Janssen vaccine, that actually was picked up by the VAERS. They discovered 15 to 20 of these CVT associated with millions of doses. So it's a very good idea to track that data. What happens with the data? Well, the scientists look at this very closely. They look for trends, and they try to show by doing a very careful study to see if that study or that complication or adverse effect is actually associated with the vaccine. And then they use statistical modeling. They look at all the cases. Early on, because this was a question early on with the vaccine production, there were roughly 1,900 deaths associated with the vaccine. So the FDA and the CDC put together a study team, and they looked at every single case of those deaths, and they discovered that those deaths were not related to the vaccine. They actually were related to that person's chronic medical conditions. So that's an example of a study that's looked at very carefully. Does that help you at all? Okay. There's lots of good data out there. I'd be happy to share that data if that question comes up. Thank you.
Thank you, Dr. Urbino. Okay, well, I'll go ahead and let's begin that 30-minute timer, if we could, Jared. And like I said, my prepared comment is much less than 3 minutes. I think probably each of our Board of Health members have already made up their mind about how they're going to vote on this resolution, but we'll find out. And so the resolution has been moved and seconded. Public comment has been heard. I just want to say that the resolution in support of voluntary COVID-19 vaccines is just that. It is not about alternative or complementary therapies, although some may prove helpful. It is not about interfering with that primary relationship between a patient and their physician. That relationship is essential. It is not about having a healthy lifestyle, good diet, plenty of exercise, etc., which we all know are important. It is not about current and future therapies such as monoclonal antibody treatments or the upcoming oral anti-COVID pills, which are being developed and hopefully available to us very soon. This resolution is just about the vaccine. It does, however, mention the subject of previous COVID infection as relevant, as something to consider when speaking with your physician about getting a vaccine. And most importantly, there is nothing in the resolution which is about imposing a mandate. None. Not even a hint. It is also not a political statement. It is not about taking away a person's individual freedoms. The Board of Health and the El Paso County Board of County Commissioners have not and will not, I am assured, support mandates. They have already said so in another resolution. People are completely free to choose whether or not they get the COVID-19 vaccine. The phrase voluntary is in the resolution twice, just to make sure there's no confusion. What is in there is a statement of strong support for voluntary COVID-19 vaccinations as the best, but not the only tool we have for coming out of this pandemic. There are a lot of numbers and statistics in there, but one number is not in there, the number 800,000. That is the number of Americans the Johns Hopkins University Center for Biosecurity estimates have died as a result of COVID-19, more than we lost in battle during the Civil War on both sides. So finally, personally, I am optimistic that we are on the downward slope of this virus, that by the spring of 2022, COVID-19 will just be a part of the background of viral diseases which we encounter throughout our lives. What I am not optimistic about is that this is the very last time we will see a novel virus sweep around the planet, killing or sickening millions. The lessons we learn from COVID-19 today will stay with us into the future. So that completes my statement. Dr. Vu, do you have something to say to the group on the resolution?
Yes, thank you, Dr. Turbush. So COVID-19 vaccines are safe, COVID-19 vaccines are effective, and COVID-19 vaccines save lives. I am in full support of this resolution to support COVID-19 vaccination. I'd like to emphasize the intent of the resolution, which is to support COVID-19 vaccination, at the same time recognizing that COVID-19 vaccination is voluntary, but the support is for COVID-19 vaccination. Thank you.
Thank you, Dr. Vu. Ms. Kari Kilroy, please.
Thanks, Dr. Turbush. So I have listened to what everyone has said. I've talked to people that I trust and know in the medical field and research, and I still wholeheartedly support this resolution. I think that we probably should have done it sooner, if I'm being honest, as a Board of Health. But I also think none of us thought that it would even be necessary. It seems almost like a given to me that public health would support this vaccination to try to lessen this pandemic. I think that's all I need to say. I feel very confident. There was a lot of sort of innuendo that we'd be liable or sued someday, but I just feel confident. I trust in the experts that we've heard from, the public health staff, and that's where I go. Thank you.
Thank you. Ms. Doris Ralston. Kind of move there you go, on and point it at you.
Prevention is a cornerstone of public health, and as a Board of Health, I believe it is our duty to advocate for and support policies and measures that impact positively the health of the populace in El Paso County. I think that the side effects of vaccines are very minimal at best, and they do save lives and prevent illness and hospitalizations, and so I support the resolution. Thank you.
Okay. Commissioner Gonzalez.
Thank you, Mr. President. I want to thank all those who came out today and at the last meeting to discuss this item, and for the work done by this board and our entire community to curb COVID. I appreciate our entire public health staff and their ongoing efforts. I have been supportive of those making voluntary vaccination decisions for themselves and their families. However, my perspective today remains as it did a month ago when this proposal was brought forth by a Board of Health member. Specifically, from my perspective, and as she had proposed back then, and it is stated in our October 27 minutes, if you read it, the request of a resolution that day was an effort to push back and counter at county commissioners who had stated opposition to federal and state mandates, vaccination mandates. This resolution, though absolutely different than that, has become, for many reasons, a greater polarizing agenda item than most expected, and remains, for me, tied to that original pushback at commissioners. As was predictable, the debate among factions on this issue has only grown, and unfortunately ensures this resolution likely doesn't end up doing what the majority of the Board of Health, working in good faith, intended it to do for the public. As a member who has fought for 2 years to ensure our community has been safe and healthy and fought to receive fair share of vaccine doses for those who voluntarily wanted it, I find it unfortunate that this resolution retains the tie to a separate issue of vaccine mandates, which I oppose, and to a Board of Health member's previous protest of county commissioners. As such, I recommend tabling this, as I will not be able to support the resolution put forth today that originated as a protest to county commissioners by a board member.
Okay. Mr. Ted Collis, please.
Yeah, I want to thank everybody who stayed for a long day today and the last time that we met. That's 2 days out of your life that you gave to an issue that you feel very strongly and passionately about, and I certainly appreciate the time and the energy that you put into your opinion and stating your opinion to this board. I'm personally against vaccine mandates. I would not support a resolution requiring mandated vaccines. I feel that those who are upset today because of, and several people have mentioned mandates, please know that that is not our intention. It's not my personal intention and not the intention of this resolution. We have heard your comments, and since the last time that we met, we have added language to this. We intentionally added the word voluntary in the heading. We added it again in the body. We added a section, a whereas clause, that says that we want everyone to thoughtfully consider what their medical situation is. We want everyone to consult with their personal physician, and we want people to make informed decisions. We included language about religious beliefs and previous infections. That was done intentionally based on the comments that we heard at the last meeting. Therefore, with all of that said, I will support this resolution.
Okay, thank you. Councilmember Donaldson.
I want to also thank everyone that's here right now and was here earlier to give us your opinion. I also want to thank those who sent in emails to all of us. That's the way it should work. We need to hear from you. As many of you know, I had a 21-year Army career, and in that time I was a Special Forces medic, I was a paramedic, and then I was a physician assistant in the Army. And then I practiced as a physician assistant after the Army. I've personally given and supervised thousands, if not tens of thousands, of immunizations. We like giving them in the Army. We used to give them all the time. Those were different vaccines than this one. And my concern with this one, those had full 5-year, 10-year trials, well studied. Everybody we were giving them to was an adult. My concern with this is we're painting with a broad brush and recommending it for everyone, including those 5 years of age. Last night I sat down and tried to write, I wrote out something to say today, but I think I really said it well in a letter that I had sent to one of the board members up here. It's to the president of the board. I just want to read that. It was only about a week ago when I sent it. So this is that email. Thank you for your effort to improve this resolution and make it acceptable to all board members. I won't be able to vote in favor of this resolution as it is currently drafted. I also don't think a public debate about this resolution at our next meeting is really what any of us want. I do think there will be even more citizens testifying against this resolution, there were, and there may be a protest outside. If I wanted any of that, I would simply stay quiet and let it happen. I'm trying to prevent it because I'm trying to get consensus. You have talked about how, and this again was to Dr. Turbish, you have talked about how discussion about this issue, quote, tends to harden already formed opinions, end quote. I think we are heading down that path. I don't think this resolution will influence anyone to get vaccinated, but it will increase distrust of the Board of Health. The concern will be, why are we only recommending the vaccines? Any talk of monoclonal antibodies? Any talk of strengthening our immune system with vitamin D? Any talk of anything else? No. Here is my concern. The VAERS, or Vaccine Adverse Event Reporting System database, whose function is to alert us to potentially unacceptable risks with vaccines, is giving us concerning information in regard to the COVID vaccines. VAERS shows that in the United States, there have been 664,745 adverse events, including 8,898 deaths and 56,297 serious injuries in the U.S. between December 14, 2020 and November 19, 2021. Among 12 to 17-year-olds, 23,484 total adverse events, 1,439 rated as serious, and 31 deaths during this same period. There are 1,390 reported miscarriage or premature births, thousands of reports of blood clotting disorders, thousands of reports of myocarditis. These numbers were released by the CDC on 11/29/2021. All studies have shown that there is significant underreporting with VAERS, suggesting that the true numbers are actually much higher. I will have the latest numbers at our meeting on the 15th, and I do, and we'll share those with the board and those in the attendance. I think these numbers give us reason for reconsidering a blanket recommendation of the vaccines by our board. There's not much left. Our resolution does not address risk stratification. As you know, there are serious, respected medical professionals who believe the risk to healthy children is greater from the vaccine than from the disease. One number I have heard is the risk of death for a healthy child is 5 times greater from the vaccine than from the disease. I also believe the number of deaths of children with COVID throughout our country is approximately 400. All of them had significant comorbidities, morbid obesity, pulmonary fibrosis, etc. I think you are aware that Dr. Stephen Gundry, a pioneer in infant heart transplant surgery, quote, said, quote, messenger RNA COVID vaccines put many patients at higher risk of a new acute coronary syndrome, such as a heart attack. He presented this information at a recent meeting of the American Heart Association and in the journal Circulation. He was speaking about adults, not children. Even in adults, risk stratification makes sense. We should address this in our resolution. If we are going to have so many whereas clauses reassuring our citizens of how safe the vaccine is, we should balance that with one more clause, with more than one clause, and the one we have is taken from the county commissioner's resolution, which says to consult your doctor, etc. In our resolution, we also do not address natural immunity. The CDC recently stated that approximately 140 Americans have had COVID. Many studies suggest their immunity is broader and longer lasting than that achieved with the vaccine. So if they are vaccinated subsequent to being infected, they may be receiving all the risk of the vaccine without any of the benefit. Final paragraph. I would like to meet with you before this draft resolution is posted on the public health website and further discuss my concerns. You state in your letter, quote, we are learning the wrong, well, this is the name of the letter. We are learning the wrong lessons from COVID-19 that, quote, to reject the COVID-19 vaccines is not only anti-scientific, it is selfish. I don't think the MD, the medical doctors, the scientists, the researchers, the parents and others who have concerns about the vaccine are anti-scientific and selfish. In fact, Dr. Robert Malone is one of the inventors of the mRNA technology, and he has deep concerns. I think they have legitimate concerns about its safety and necessity in all groups. That was the end of the email. So again, I ask that we slow down, don't pass a resolution recommending this for everyone, even though it's a voluntary recommendation, but try to use a little more thoughtfulness and maybe separate out very young children, folks who have had heart attacks previously, as that study that was published suggests the vaccine may increase their risk, and simply not use a one-size-fits-all solution. Thanks.
Thank you. Thank you, Councilmember Donaldson. So the motion has been moved, seconded, and we've heard public comment. Each of the Board of Health members has had a chance to make a comment or a summary statement. I think it's time for a vote. And Mary, are you there to make sure?
Mr. President?
Yes, please.
I would like to offer an amendment to the resolution.
Okay.
And my amendment that I would offer would be to add that the Board of Health does not and will not support vaccine mandates. COVID vaccine mandates.
Okay, you need to make that into a motion, please.
Okay, I make a motion that we amend the resolution to state, whereas the Board of Health of El Paso County, or however you want to phrase that, we can work it out, recognizes that vaccine decisions should be made between a patient and their doctor. We will not and do not support vaccine mandates.
Okay, is there a second for Councilmember Donaldson's motion?
I will second. I'm okay with somebody, and if there's an intent to revise some of that for legal clarity, but I'll second.
Okay, well, let's take a vote on the amendment first, and then we'll take a vote on the resolution. I think we could probably do it by assent. Let's do a roll call, okay? The subject is the motion put forward by Councilmember Donaldson to add the verbiage to our existing resolution. We either aye means that we are for the motion and want to incorporate it. A nay is we don't amend it. So, Dr. Vu?
Nay, I would support the resolution in its current version.
Okay, Kari?
Nay.
Aye.
Nay. I think it's restating the obvious because it's already stated as voluntary.
Okay, Councilmember Donaldson, it was your motion.
So, aye.
Okay, and chair votes nay. So that amendment, the motion to amend failed. So again, on the table is the resolution itself, and I'm going to do this the same way by roll call. So the motion on the table is the resolution in favor of voluntary COVID-19 vaccines. Okay, Board of Health member Dr. Vu.
Aye.
Aye.
Nay.
Let's slow down here. Okay, Dr. Vu is an aye. Okay, sorry.
Aye.
Okay, Doris.
Aye.
Commissioner Gonzalez.
Nay.
Okay.
Aye.
Okay, and chair votes aye.
No.
Oh, well, that's not fair. Councilmember Donaldson votes no. Got it. Okay. 5-2, and Cammie's not here, so she really can't vote. So the resolution on the favor of voluntary COVID-19 vaccine passes 5-2, and we'll make that part of our meeting minutes. Now, I did promise everybody that there would be another public comment section for any other items that we haven't covered. So let me just throw that open to the group here. Are there any members of the public who would like to comment on any other item? And I think we're still able to do that, right? Okay, we're good, Jared? Yes, sir. Please tell us your name again. I'm sorry.
I am Goldman.
Okay, got it.
You tell us that this was not about mandates, and yet you won't put it in writing. Why is that? Voluntary doesn't say no mandates, it means voluntary. We've seen mandates. They came down from the governor's office, business closures, mask mandates. You didn't stop it. You didn't stand against it. Why should we trust? Councilman Donaldson said this is a matter of trust. He's right. We asked you to table this so that we could work it out in the community and everyone could be represented. A doctor, you work for UC Health. This is how the FDA has done it. This is how they've been working for years. All of the people that spoke today that you brought up, all of them spoke for vaccines. The VAERS data, we know the line. We know how it gets dismissed. There have been more adverse reactions to this vaccine than all other vaccines in 20 years, and that's not concerning. But what was really telling, and I thank Councilman Donaldson, who's been the only one to stand up for the people of this county that think this is a dangerous decision and that what you've just done will cause people to lose their jobs because there are businesses that are scared of getting sued over COVID, and they're going to use this resolution that you just passed to tell people that they have to get the jab or leave their job. Alex had to leave med school because of it. This is going to be used to persecute the people of our county. And you just passed it. But what's really telling is you say you won't support mandates, but you wouldn't add it to the resolution. And that's incredibly telling. If you want us to trust you, put it in writing. Put it in writing. We don't trust you. And what should be in writing is that if any mandate comes from anywhere, so you don't mandate it, but it comes from the governor, or it comes from the federal government, or it comes from the UN or anywhere else, will you just lay down? Or will you defend us? We don't trust you. And this resolution you just passed is going to be used to pressure, to coerce people. And I'm telling you, the blood's going to be on your hands for that. And I'm sorry to have to say that, but we tried to work with you and you wouldn't listen. You're not being the Board of Health. Health is not found in a syringe. It's found in a lifestyle, and you should support that. And I expect that there be another mandate that's on the agenda next time this board meets that is a full-blown, in-writing resolution that there will never be mandates enacted or supported by this board. Thank you.
Thank you. Any other members of the public who would like to comment? And this time is reserved for discussions other than the resolution that was just passed. So other topics. Any topic, please. Any comments from members of the public? Okay, I don't see any. Are there any online? Any people remaining on? No? Okay. I would entertain a motion to adjourn this meeting of the El Paso County Board of Health. Okay, a second?
Second.
All in favor?
Aye.
Aye. Any opposed? We're adjourned.